Hi, good morning and welcome to the Wednesday, May 13th, 2020 Board of County Commissioners meeting. I'm Kate Flavin, Public Information Officer with Sedgwick County. You'll notice again, we are still social distancing in the commission meeting room. And remember that you can watch our meetings now live streamed on Facebook and on YouTube. And we are also broadcasting on KPTS Channel 8. On the agenda this morning, Commissioners, we have meeting minutes. We'll receive an update from our Health Director on the latest on COVID-19 news. There will be a discussion regarding the extension of the local disaster declaration. A discussion of the CARES Act will continue. The Health Director will be back up to talk about an amended grant application to the Kansas Department of Health and Environment. You'll receive the 2019 Comprehensive Annual Financial Report. Then we'll have the quarterly financial report. You'll consider a resolution to establish details of a public hearing related to boundary modifications for the BOEING Industrial District. And your last two agenda items are related to the purchasing process. So with that, Chairman, I will let you get this meeting started.
Thank you, Kate. Good morning, everybody. Good morning, commissioners and staff. Welcome to the Wednesday, May 13th meeting of the Sedgwick County Board of Commissioners. We've got some good things we need to talk about today and vote on. So with that, we'll call the meeting to order. And Madam Clerk, next item.
Invocation to be observed by a moment of silence. Please remain standing for the flag salute.
Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. Madam Clerk, next item, please.
Roll call. Commissioner O'Donnell?
Present.
Commissioner Dennis?
Present.
Commissioner Howell?
Present.
Commissioner Cruz? Present. Chairman Meitzner?
Present. Next item, please.
Public agenda.
Commissioners, you've seen your emailed copies and your printed copies of the public agenda items. There was a handful. I don't know if anybody has any that they want to point out or reference to. Yes, wait.
Mr. Chairman, I might point out that in accordance with the Attorney General's guidelines for meetings during this period of time, we do need to announce at the beginning of the meeting when we're having an executive session, and we are having one today, and we'll be remaining in this room later in the meeting. And also, we need to let the public know how we're taking public comment, which is essentially what you were just doing now. We've been taking it by email.
And my apologies, Mr. Papoon, and thanks for the reminder. So we will be having an executive session at the end of this meeting. And again, our public comment, that policy during this pandemic has been to get your comments to us or to the communications email by 5 o'clock Tuesday before Wednesday. So with that, we do have some public comments. Is any commissioners you've had a chance to review? Any comments?
Move to receive and file.
Second. Been a motion to receive and file public comments. Madam Clerk, call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis? Aye. Commissioner Howell?
Aye.
Commissioner Cruz? Aye. Chairman Meitzner?
Aye. Madam Clerk, next item.
Consideration of minutes. Item A, regular meeting minutes of April 15th, 2020.
Commissioners, you have in front of you, and you had a copy of the minutes from, I'd like to maybe combine A and B from our April 15th and April 22nd meeting. If there's no objection to that, I'll entertain a motion to approve.
Second.
Motion and second. Is there any comments or questions, corrections? Being none, Madam Clerk, call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Aye. Chairman Meitzner?
Aye. Motion carries. Next item, please, Madam Clerk.
New business. Item C, Sedgwick County Health Department update on COVID-19.
Chairman and Commissioners, Tom Stolz, County Manager. While Adrian's taken the podium, I just want to lay out the landscape for this particular item today. Typical of what we've done the last several weeks, Adrian will update us on Health Department news. Rusty will have a very brief presentation on PPEs. Tim will have a little bit more lengthy presentation on testing because there's been a lot of movement on that the last few days. And then Tanya will bring back the recovery plan that we discussed last week with some altercations to it. So with that, Adrian, please.
Okay.
Good morning, Commissioners
Good
and
morning,
Board of
Adrian.
Health. Adrian Burns, the County Health Director. So as reported by John Hopkins, Kansas has 7,927 cases of COVID-19, and Sedgwick County has a total of 471. Just a reminder, if anyone is currently ill, to please call 211, and there is no out-of-pocket expense to be sampled at our sample site and then sent to the testing lab. As restaurants and sports bars begin to open, it's important to know that those that are taking temperature checks, that is a great start, and I think will aid us also as we get into flu season. But it's important to know that 63% of the COVID-19 cases had fever, and the others, the top two symptoms are cough and fever. So where the temperature check is one good step, it's important to not believe that is the only thing needed. Hand washing is still important, and social distancing and keeping the hands away from the eyes, nose, and mouth. So Sedgwick County Animal Control recently received a donation of 27 pallets of dog and cat food. After sharing with local shelters, rescues, and food banks, we still have a lot of cat food available to the public. So more details on this pet food distribution is coming. Watch Sedgwick County's social media pages to learn more about this. So more than 120 people are working on the Sedgwick County, on the Health Department's COVID-19 response team. Of the 120, about 2/3 are Health Department staff, and the rest include county staff, City of Wichita employees, and volunteers. Now, Colorado and Louisiana have been removed from the list of states where if someone travels from that they need to quarantine for 14 days. Maryland has been added as of 5/12. Massachusetts, Rhode Island, Connecticut, Illinois, New Jersey, New York are still there, are on the list as far as quarantining if you return from one of those states, as well as cruise ships and river cruises after 3/5. And that's my report.
Very good. Who donated all that? The pet supply food?
That is a good question. I don't have the name
okay.
with me, but I will get that
Well,
to
thank
you.
you.
Very
That's all right.
generous.
Thank you for whoever did that. Very generous. And also of the 471 cases, that positive cases, and how many of those have recovered? Would you
How many,
remember?
that is on our Sedgwick County website as far as how many that have recovered in new cases, but more are recovering every day.
Right. 370. I knew it was over half, so 317 or so, 300 out of
It's very
471.
positive.
So very
Yes.
good. So thank you for you and your staff. So when somebody's, just to remind, when somebody's positive, then you instruct them to go home and quarantine and family.
Yes, if someone's positive, they need to be isolated, and it was changed, the guidance was changed last week to 10 days. Instead of 7 days, 10 days. So if someone is being tested, then they wait at home, and two things. So if someone's positive, then they are at home for 10 days, either from the onset of the symptoms or 3 days symptom and fever free without any kind of medication, whichever is longest, but at least 10 days. And then if someone is quarantined, and again, we are testing or offering tests to anyone that is a close contact of someone that is positive. And even if their test results return and are negative, they still need to stay at home those 14 days because they could develop symptoms later and be infectious.
Okay, because hospitalizations that's a different level, and they've been minimal.
They have been.
Been minimal. So, okay, Commissioner Dennis.
Thank you, Mr. Chairman. I have a couple questions. When we are identifying the people that are identified as having COVID-19, are those confirmed cases, or does it also include suspected cases?
Those are all confirmed cases. So if we have someone listed as a COVID-19 case, that means that they have been lab confirmed. And then anyone that is suspect is going to be at home, and we're going to test them awaiting those results.
Very good. And I understand we've got about 9,000 test kits available right now.
We do. It is fabulous.
That's fantastic. I got a couple questions along those lines. First of all, are we going to start doing antibody testing also?
Not at this point. We're gonna, our preference is to wait until it's fully FDA approved versus just being allowed to be on the market. There are still some false positives. So just giving that some more time. We know that the antibody can pick up COVID or coronavirus viruses, but its ability to specifically specify the COVID-19 is still in question a little bit.
Okay. A couple questions on, questions on testing.
Commissioner Dennis, because Tim is going to cover all the testing stuff. You want to wait, and is it about testing? Because I think Tim will be presenting and covering a lot of that. Is that all right? Unless you have a question.
I can wait till Tim.
Okay.
And ask my questions then. Thank you.
Okay. Okay, thanks.
Okay.
All right, Adrian, thank you. Keep up the good work. Next up, I think you said Rusty, but who do you want?
Let's go ahead and go right to testing since Commissioner Dennis has
Okay.
testing questions.
Hi, Tim. Welcome. Thank you. Thanks.
Good morning, Commissioners. Since our last, Tim Kaufman, Deputy County Manager, since our meeting last week, the Health Department ran their drive-through location 5 times, served 526 people. KDHE tells us that over 5,000 individuals in Sedgwick County have been tested. Our Health Department has done over 1,500 of those. We do continue to have capacity at West Central, and we'd like to serve more folks. And so I continue to encourage anyone in the community that isn't feeling well to call 211 to talk about their symptoms, and hopefully we can get them scheduled for testing, which is free to the individual. As Commissioner Dennis revealed, our current swab inventory is 9,773 sampling kits. We still have over 10,000 kits on order, and we continue to make requests of the state and to place orders with other vendors. Because we've received some significant supply shipments this week, we're also starting to plan some randomized community sampling events to provide us with statistically significant data that will help us understand the virus in the community. We're going to need to contract with an organization that can identify a randomized representative testing pool, make those calls, and get folks scheduled. But we've already been in contact with 2 different organizations that do that type of work, and we'll continue to do that until we can find someone that can help us make those calls, again, on a randomized data set. And we hope to have that ready to go in a couple of weeks. However, our emphasis continues to be on individuals that have COVID-19 symptoms, and those symptoms include a fever, persistent dry cough, shortness of breath, chest tightness, chills, muscle pain, headache, sore throat, a loss of taste or smell, and a new one is unexplained diarrhea. If anybody experiences those symptoms, please call their primary care provider or 211 to begin that screening process. Testing is an important tool in the workplace and for occupations that are at high risk, and we like to work with individuals in those categories as well. So the Health Department offers no-cost testing to symptomatic and asymptomatic Sedgwick County first responders, law enforcement, healthcare workers, meatpacking plant employees, and people that work in residential group settings such as Department of Corrections, residential schools, or group homes. And so we're also, so that's the exception to the symptomatic folks that we test. We're testing folks that are in those high-risk categories. Now, we've talked a little bit about transportation issues in the past as it relates to testing. Health Department has had access to a ComCare van that has been modified with safety features that allows them to transport individuals to the test site. At some point in time, ComCare will need to return that van to its regular, normal role. And so we're working with Fleet Department and Purchasing right now to identify an additional van or replacement that we could modify with necessary safety features that would allow us to continue to provide transportation to anyone that needs testing. And I'd like to again emphasize that transportation shouldn't be a barrier to anyone that needs testing. Encourage them to call 211, and we'll help them with that process. And finally, I'd like to thank our partners at Health Corps, their efforts ramping up their mobile drive-through test site. They're testing Monday through Thursday, and they're testing asymptomatic individuals as well. So that data will help us greatly as we get those test results back. We'll have a much better handle on what's going on in the community. If I didn't get to your questions, I would be happy to answer any of them.
Yes. Commissioner
Thank
Dennis.
you. You kind of touched on one, and that's the transportation of individuals. I think that that's critical that we do have that available. But the second part of it is, that was the first part, getting the people to the test sites that we have that are fixed test sites. But I still think that we need some mobile testing equipment, some type of motor home or something that we can get out to where the people are, because our county is so big. One of the biggest clusters we had was down in Clearwater. I truly believe that we need to get some vans. I don't know if you need one or if you need more than one in order to be able to transport the people to the fixed test sites, but I truly believe that we also need some type of a mobile test system that we can use throughout Sedgwick County. So I think that those are very important. I think they both fall within the requirements of the CARES Act. I think that they're important. I make a motion that you bring back a proposal to us as soon as possible on how that we can have mobile testing available and the vans that we need in order to get the public to the test sites that are fixed.
Second.
Okay. There's a motion and a second. I think Mr. Stoltz might have a comment on that.
We are going to have a presentation under item E regarding CARES money. And I don't care if we handle the motion now or if you wanted to lay it till that item. It might be more appropriate to talk to it under that item, but will of the commission. We'll roll with whatever you do.
Well, there's a motion right now for just to bring a proposal back on the options of mobile.
My motion was for you all to research what it takes to get that and bring back a proposal as soon as possible.
Right.
I don't know that it needs to go during CARES Act or at this point. But
That's okay.
I don't see why we wouldn't want to move forward with some decisions.
Thank you, Mr. Chairman. When Commissioner Dennis brought that up last week, I thought it was brilliant having some type of bus similar to like what the Red Cross does when they go out on their mobile blood drives. It makes a whole lot of sense to me, because that way it can serve every point in the county, and the amount of people will be drastically better served because we would have that, and people wouldn't have to drive very far if we went into all of the smaller communities as well. So I think it's brilliant, and his years in the military are paying off with ideas like that. So thank you, Commissioner Dennis, for doing that, Mr. Chairman.
Commissioner Howe.
Thank you, Mr. Chairman. Excuse me. So just wanted to clarify, so what you just said a minute ago is that if someone needs transportation today, they are able to get transportation as of right now. There's nobody being not tested because of a transportation challenge.
That is correct.
Has that been going on for very long?
It has been. We've had that van for a number of weeks. We just finished with the retrofitting from a safety perspective, but we've had it available. We've transported people for a number of weeks.
Well, that's really great information, because we did talk about this last week, and I'm also very supportive of the idea. I think that the mobile unit is a great idea, but I wanted to just make sure that everyone understands we've not failed to test someone because of transportation. So I think it's a really important point for us to make today. Thank you. And I do support the motion. I am interested in the Health Corps data, which is kind of a new thing that kind of popped up, which is great. But just wanted to clarify, we are going to be able to access the results of their testing. Of course, we don't need to know any details of who they're testing necessarily, but the details of the number of tests that are administered, whether they were symptomatic or asymptomatic, and the results of those tests, that we will have that data?
I'm certain that we'll have the results, and I think that we'll have the information around whether or not they're asymptomatic or symptomatic at the time of testing as well, where all those results will get reported to KDHE, and then they'll come back. As I mentioned earlier, there's been over 5,000 people in our community tested. We've tested about 1,500 of them, but all those results come back to us through KDHE. So we will get the results, and I don't have any doubt that we can't work with our partners at Health Corps to have a better understanding of the population that they've sampled as well.
Very good. Well, thank you. And I know we talked about it last week, and I've actually just wanted to mention, I did actually formally request this through my email to Manager Stoltz last week as well. So I think this has been a thing that I think most commissioners have been thinking about, and I'm very supportive of the motion. Thank you.
Commissioner Cruz.
Thank you. I see on our dashboard, we have 6,825 tested. So that's every single provider in our community.
Correct.
And then these are updated, this website is updated at 2:30 in the afternoon.
It is. One of the things that KDHE has changed is they're only providing updates on Monday, Wednesday, and Friday. So that state data is going to be updated on those dates.
Okay, so I had a question about the health core data as to when it would be updated on here. So the 86 new people that were tested as of 5/12. So we'll get how many new people that we have tested here locally. Or do the providers have to ship their information to KDHE and then it comes back to us?
Correct, yeah.
Okay.
And there's going to be a little bit of a lag. So the samples are taken on Monday, for example. They're going to go to the lab probably that day, maybe the next, depending on the time. And then it takes a couple more days to get results. So I don't think that we'll start to see all of the health core results, for example. Probably maybe Friday we'll start to see some of that impact on our numbers.
Okay, and then if we, seeing that they have a pretty robust system, I know a lot of folks went over there. We're sitting on this 9,700 test kits. How many do they have? I heard 1,000.
That's my understanding, is that they start at 1,000. I'm not sure what their arrangement is with Quest. Quest is the lab they're using. If they're going to replenish those, or I don't know what their plan is yet. We'll try and find out more about that.
Okay, so we're kind of leaving it to them to get their own testing kits? Okay.
We'd certainly be open to work with them if they need additional.
Good to hear. All right, thank you. That's my question.
Yeah, thank you. Good questions. Okay. We're reminded that KDHE is taking test information all over the state and trying to divide it out back to us by county. But my compliments. It seems like our community continues to do nice, and thank you to Health Core, sorry, for setting that up. That's another added bonus. And I know the chamber has got a website for all kinds of PPE sources, both paid and unpaid, and so it looks like we're rallying very well. So my compliments again to everybody. So, Commissioner Howell.
One other question: Do we know whether or not Health Corps has been able to provide testing to all of those that have gotten in line? Are they having to turn away people at the end of the day? Do we know?
I don't have any specific detail. That one of the things that I noticed in the media was that they had announced at a certain point in the afternoon that they weren't able. They had kind of reached capacity. So my guess is that they're having to encourage people to schedule the next day.
I guess with that in mind, since we're scheduling most of our testing at our test site there on West Central, if we have capacity left, why would we not allow, if you will, some of the same population that wants to be tested that are asymptomatic, that are maybe not the qualified folks that you mentioned a minute ago, but they want to be tested for whatever reason. And one of our goals is, of course, is to test the population as much as possible. We have the test kits available now. I'd like to see us consider opening that up to use up our capacity and get more tests done for our population. I think that would be appropriate at this time.
That's another very interesting idea, and I'm sure that we'll get Adrian and the folks at Health Corps connected to figure out if there's a way to make that work as well.
All right, thank you.
Commissioner Cruz, follow up?
I was just going to mention, you mentioned that you're working with a company to do random samplings. So it'll take 2 weeks to do that.
What we would like to do is to do a fully randomized representative sample. So we're going to need to find someone who has a data set that will allow us to reflect the full community in terms of age, income, all those different distributions. They'll make the calls for us. We need about 1,400 folks to get a statistically significant response. And so that takes a couple thousand phone calls. And that's not something that we do, so we're going to find somebody that is an expert in that area to identify that data set. And then, so what we're going to be doing is a little bit different than what Health Corps is going to do, but both are excellent data points to help us with understanding the virus.
Okay. And then the other question was, I asked last week about the 211 data as far as like what questions they're asking. I just want to say thank you for getting me that data as far as the number of people who have called in, the number of people who have been sent to us. So I appreciate you guys getting me that data.
Okay, thank you. Thanks, Tim. There's a, go back, there's a motion and a second on the floor. And so any other, I assume you also mean bring back something that says how much it's going to be to staff it, and maybe they can choose days a week and say, or whatever it is, but they'll bring back something. Okay, thank you.
I guess, how long do you think that will take to do? I mean, as soon as possible is ideal, but if we could put sort of a week, how quickly can you get that done?
My motion said bring it back next week.
Well, you said as soon as possible, so I'm just trying to clarify.
You said as soon as possible. That's right. For Wednesday, okay then?
I'd like to see something next week if they could bring it back. Is that possible?
We can provide you with something next week.
Thank you.
Thank you.
Okay.
So, hold on. In addition to the 211 questions, though, are they asking whether they need transportation? Do you know?
I think through the questioning process, the conversation process, they ask about whether or not they've got issues, any kind of barriers. And so if they do identify those barriers, they work with them to overcome them.
I mean, I'm supportive of offering transportation. I just wonder what the need is.
Yeah, it seems to be, right now, it's been very limited. And we don't know if that's because people don't understand that transportation is available, so that's why we wanted to make sure we talked about it again today, to make sure that people understood that we hope that's not keeping them from calling. It appears that of the people who call, very few of them identify transportation as a barrier, but we're happy to help that, and hopefully people now understand that even if it's a barrier, they can call and we'll help them work through that.
Sure. Thank you.
Okay. Looks like no other comments, so there's a motion and a second to bring back a mobile plan by next meeting. Madam Clerk, call the roll.
Commissioner O'Donnell? Aye. Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. So we're still on item C. And next up, thanks, Tim, for your help. It's very informational. Next up, do you want Rusty? Is Rusty on the phone?
I am on the phone.
With our new mics?
Turn him up here.
Can you hear me okay?
I'll ask them. Can they hear? No, I can, yeah.
Okay. Good morning, Chairman and Commissioners. This will be a very brief update on the Emergency Operations Center and protective equipment. There's not a lot to report. We are kind of in a good mode. Logistics is keeping up with requests and receiving the burn rate reports on a weekly basis. They get those Tuesday around close of business is whenever they finalize the report. Currently, we are continuing to be able to fill those gap needs for the 120 to 140 reporting agencies, depending on the week, how many of them report. We do need to continue to receive shipments of N95 surgical masks, gowns, and some of those materials. And we are receiving small shipments throughout the week either from Wichita State Tech, who has been helping us acquire, or from orders that purchasing has placed, which are coming in when they come in. There's never any guarantee, and we still don't have a consistent supply coming with regularity, but we do have small orders coming in to the warehouse so that we can push those out as needed by various agencies. Kansas Department of Emergency Management, the state indicates that they have resupplied on some of those materials, and we continue to make requests from them for reasonable numbers to help supply our needs down here and to keep materials in our warehouse to fill those gaps as they come up. Additionally, this week there was guidance from the state, from the Kansas Department of Emergency Management. Early in the week, I realize this is Wednesday, but it was kind of over the weekend, early in the week, that there was some guidance directing dentist offices as they begin to open to reach out to the local emergency management office to seek assistance. They have obviously not been been part of the EOC agency group to this point. We had concerns that was going to put us in a position where we wouldn't be able to fill their needs because it would stress the system since they've not previously been involved. New guidance has come out in the last day indicating that the state really can't support them beyond face masks. So we've made orders from the state for face masks to support the dentist offices who've reached out. We've additionally directed them to the lists available for suppliers on the Chamber's website and given them some direction in that way to help them get what they need so they can get back in business as the governor's order allows. And finally, the sanitation of N95 masks, the Patel system that was set up in Topeka. Just to let you know, we've had about 40, maybe a little over 40 agencies in Sedgwick County who have registered with Patel in order to use that service. We do have a drop-off point set up and active in Sedgwick County for that purpose. Out of Post 8, EMS Post 8, there's room up there for them to do that, and the sheriff has supplied the project manager for that. So that is up and running. It's been slow so far, but we have received some masks and shipped them to Topeka for cleaning and sanitation, and we may see an uptick in that if needed. But currently, across the whole system, based on the on-hand and burn rate report that we received yesterday, most organizations and agencies are in pretty good shape at the moment with supplies. So that's about what I have to report right now. Is we're doing okay. We do need to continue to see receipt of small shipments either from the state or from those orders that we've made through purchasing, but right now we're doing okay.
Rusty, can you tell the public where Post 8 is?
Sure. Post 8 is the EMS post that's on 53rd Street, just west of I-135 in Park City. In order for that to be utilized, it does have to be an agency that's registered with Patel and has to meet the requirements set forth by the state and by FEMA. But all the agencies that are eligible have been notified, which would include those dentist offices. We've given them notice of that as well so that they can get their masks cleaned if that's something they wish to do.
Okay, thank you.
Yes, sir.
Commissioner O'Donnell has a question.
Okay.
Thank you, Chairman. So, Rusty, I had an individual reach out to me from Quick Stitch. They're making some masks for us. Is that correct?
That is correct.
They were saying they have capacity to make a lot more. Why aren't we buying as many as we can get right now?
I'll have to follow up on that for you, Commissioner. I know that we are we're buying masks from them. I can't tell you how many we're buying or if we have capacity to buy more. So let me follow up with purchasing and with our small group that is managing that aspect of this, working with the local businesses who are making and manufacturing. Let me check with them this morning, and I can follow up with you on what we're doing as far as how many we're buying and what our needs are there.
Okay, thank you, because I feel we have this money that needs to be spent on things like this, and if we had vendors that have more capacity, we need to be getting these out to places like, you just mentioned dental offices, for one example. We should be trying to acquire as many as we can as long as they're quality product. I think that's the goal of all the commissioners, is to acquire as much PPP as necessary for the community as well. Obviously for reopening the economy, but also for protecting the citizens and those individuals who want face masks. So I know Quick Stitch said they were looking to start selling to the city because they're not near capacity of what they can be making. So I'd appreciate knowing what we need to do to acquire as much as possible. So I appreciate and look forward to your response.
Yes, sir. I will follow up with you.
Okay. Any other questions? Not at this time, Rusty. Thanks for the update. Good luck with everything.
Thank you.
And next up, under C, I think we have Tanya, is that right? Oh, Tanya, there you are.
All right, good morning, Chairman and Commissioners. Tanya Cole, Assistant County Manager. Last week, Adrian Byrne, Health Director, and myself presented the Sedgwick County Health and Economic Recovery Plan. And I was asked to come back today with some clear distinctions to the plan regarding restriction versus recommended. And so I'd like to walk you through 3 areas that have the most significant changes. And before I do that, I just want to take a moment to thank Tony Giuliano, who's been instrumental in creating the design of this document. So let me start out just with pointing out on the cover page, you'll see the title there that says Sedgwick County Health and Economic. Right underneath there, it says in cooperation with Sedgwick County business and industry leaders. So added that there. Okay, so I'm going to skip page 2 because I want to come to that at the very end. So if I can point you to page 6, and it looks like this. Okay, want to point out there, so in bold there, what we're saying is following our Governor Laura Kelly's general provisions restricting establishment and activities. And so in the next couple of pages, in the dark red, those are strictly restrictions there. And those are Governor Kelly's executive order. Okay, and then in the next 2 pages, so those 2 pages cover that. And then on page 9, okay, looks like this. What we're saying there is Sedgwick County business and industry, and we added the word recommendations, guidelines, and best practices. So all the pages following after this, we took out the red, and you'll see that we've added again the word recommendation, guidelines, and best practices. Now, I'm not going to go through each of those because we talked in detail last week about those guidelines and best practices by industry. But I hope that meets the distinctions between restrictions and recommended as requested last week. And then let me jump to page 18. And so we did the same thing. What page 18 is, it starts in yellow. And I just might point out that the colors are the same that Governor Kelly is using on her phases. So the red, yellow, and green. So on page 18, and then the next 2 pages, states following are Governor Laura Kelly's general provisions restricting establishment and activities. So her next 2 pages in bold yellow are strictly the restrictions. So establishments not allowed to open and activities not allowed to open. And then the next following pages are the business and industries recommendation, guidelines, and best practices. Now you'll see in here for the businesses and industries, you'll see a lot of in progress. And the reason you see that is because right now the team, Tammy Bradley, myself, Aaron Davis, and Aaron Norton are in communication with these business and industries to get the guidelines. And we should have that by this Friday to fill in under the guidelines for phase 2. And then phase 3 and phase 4, again, that is consistent with Governor Kelly's phases. And then we did not have this last week, but we have it this week. Starting on page 32 are your appendix. And so this expands the tables and provides further information for businesses on employees, social distancing, cleaning, sanitizing, and then gives website links to other sources such as CDC, associations, and industries. Okay, let me bring you back now to page 2. What we added in there is a phone number, and that phone number is a Sedgwick County Recovery Plan information line. So the intent there is that this phone number is for any business and industry that has any questions regarding our recovery plan. They can contact this number to ask any questions, and we'll provide them with as much information as we can give them. If there's any questions on Governor Kelly's executive order, we've given the number there for Governor Kelly's office. And then we've also provided a link, I think it was discussed earlier, the one-stop resource for businesses and nonprofits to find information on PPE. And so if you go to this website, they've given information on where to find cleaning supplies, masks, face shields, gloves, gowns, hand sanitizers, and plexiglass, both locally and regionally. So that's new additional information that we added to this recovery plan. So I'd be glad to answer any questions that you might have on this.
Well, any questions? I can tell you, this is a really much improved, much succinct document. It really is clear, thanks to you and Tony and whoever. I like that you're matching the colors. We know that we don't even know that phase 2 is going to happen yet. I think I just had made a call, and they're still under decisions. Today's Wednesday, so Governor Kelly's office is trying to analyze statewide and who's winning and who's losing on some of these making positive gains and stuff. So phase 2 could have a different approach or be whatever, and then so we could adjust there. But this would allow us, so this will be on the website. This will allow us as commissioners, when all these, not a lot, but we get a lot of some calls about, as an industry, where can I go for, so this has the appendixes. And so from my perspective, thank you for coming back with a clearly defined state order versus our business recommendations and guidelines. That's my overall comment.
And I just might add, Chairman, we've always said this is a working document, so it can change and be fluid to adapt to that.
Okay, yeah, Commissioner Cruz.
Thank you. I just want to echo his statements. Kudos to you guys for getting this done. I know this is a ton of work, just filtering all this information. You know, one thing that I don't really see though, oh, my mic, sorry. These fancy mics. I guess, you know, we've had a lot of questions around face masks, and, you know, we have people in the community, we have some stores that are mandating them. You know, I don't know that we want to get to a point of mandating them, but we also don't want to get to a point where we have to shut things down again either. And so I think at some point in our community, we've got to make a decision, you know, do we want to be sort of uncomfortable on the front end and then make sure that we don't have to have another stay-at-home order be in place? So I guess that's the question that I kind of just want to open up. You know, yesterday, I think, Tom, you sent out a message talking about Kansas City had 200 cases in one day, and
Kansas City had a 200% increase in active cases.
Yes, 200% increase. So that's a ton of cases, and especially doing more testing. I guess the other thing that we haven't really been talking about is we talk about people being recovered, but because there isn't a lot of data on how this virus affects your system, just because they're not in the hospital on a ventilator doesn't mean that they don't have life-altering problems later. So I guess to make my pitch, you know, I think strongly encouraging face masks, as uncomfortable as they are, I think should be something that we put in here, coming from, you know, as part of our document, to have a recovery plan put in place. You know, the locations that want to mandate that, that's obviously up to them. And so they could be more restrictive than this, kind of like we could be more restrictive with the governor's order. They could be more restrictive, correct, with their own businesses. Mm-hmm. And that's kind of mentioned. I just want to make sure that we communicate that to folks. So that's, I mean, talking about face masks, I think, would be important, and doing some campaign around that. As if we're not going to mandate it, then really, really heavily, strongly encouraging people to wear those.
Yeah, your points are well taken. I know on page 10, which is the first page that we go to private recommendation guidelines, best practices, the minimum, that first section, minimum recommendations, actually the very first bullet, provide all staff with some level of face covering when interacting with the public and
Guess I just want it big and bold.
You want it bolded? Okay. Could, yeah. So strongly encourage is fine with me or something on it next. It's good. I'm glad it's first. I'm glad it's right there, right away. Yeah, Commissioner O'Donnell.
Thank you. Thank you, Tanya. I appreciate this recovery plan put together. I like having the two numbers, both the 6609000 number and also the number to the governor's office as well. For people that have questions, I can direct them there. I'm sure we're all being inundated with businesses asking us questions every day, which is a great thing. And like Commissioner Cruz said, there are some businesses that are mandating you wearing a mask if you go in. Some on their website say it, but I know I went to Menards over the weekend wearing a face mask and people weren't, but on their website it said they were. So I think it's obviously probably what the general manager at the time is saying to do. I definitely do not want to get into a place where we're going to mandate that for the entire county or not. And I think we need to be careful when we talk about things like, 100%, 200% increases, because yesterday I saw we had 2 additional positive cases in Sedgwick County. So 100% increase of that would be 4. It sounds much more dramatic than it is in actuality when you're looking at the literal numbers. Going from 2 to 4, while that is doubling, that's not 100 cases to 200 cases. So I think we need to, keep some of those numbers in mind as we're looking, because I think one day last week there was 1 case, another day there was 2, another day there was 3, yesterday there were 2, and that's with increased testing. So it matters the way that we phrase increases, in my opinion. So thank you.
Okay. Any other comments? I'd like to entertain a motion that we accept and approve this to be posted on our website and available to the public.
Second.
Okay, motion and a second. Any comments? Yep.
Well, Chairman, I think it's good to go ahead and post this, but obviously this information is still coming, and you plan on updating this as soon as that information becomes available. I'll just make a point that we're only 5 days from the 18th, and that is the date that some of these businesses are going to be directly impacted on being able to legally open. And there's not details in here for those businesses to know what to do at this point. So it's critical that we get the information as soon as possible so they know what's going to be required for them, because they have to be able to plan.
You're correct, Commissioner Harrell, and that's what I was talking about. We are currently working with the business and industries that are in Phase 2, and so we will have that information by Friday.
Okay, and that's good information. I just think that that's last minute, it really is, for them to know what to plan for. And Friday afternoon, when they're supposed to be able to open on Monday morning, there's really not much notice for those businesses. And so, anyway, so with posting this on the website, it comes with the understanding that she will update this as soon as information becomes available, and she can continue to update this as information continues to flow in.
That's correct.
Okay.
As we have new information, we will continue to update this on our website.
All right, thank you.
Okay. A motion and a second to accept this and get it posted and available to the public. Any other comments? Being none, Madam Clerk, call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Thank you again, Tanya, and thanks to everybody and all the other businesses that help provide you links and information. Thank everybody.
Chairman, as we leave this agenda item, I might just continue a discussion we had last week. And also, we went through budget hearings this week, and we've got kind of a list of items that we clearly need to resurrect a Tuesday staff meeting regarding. I would like the council or the commission to consider taking this the health department update item and moving it to a Tuesday staff for a couple reasons. First of all, it would allow us to get back to some generally more routine business for commission meetings. And the staff meeting on Tuesday is more of an environment of a discussion amongst the commission, which I think this topic, which clearly will continue for the remainder of the year, is maybe more conducive where you have a conversation versus all the protocol that we have to adhere to in a general meeting. So if it's okay with the board, I would like to move this item to next Tuesday's 9 o'clock staff meeting. We would do this as item 1, and then item 2 would be a general other government business kind of agenda item, of which we have a list of growing, and it grew quite a bit yesterday. So if that would be okay, is it possible that we could move this to a Tuesday staff kind of setup?
Yeah. I think you're getting, yeah,
Okay,
I think
very
that's
good.
okay
We'll
with
do
everybody.
that. Thank you, sir.
Do we need to have a motion for that, or we just? No.
I don't think so. We'll continue to talk about it. It'll just be in a little bit different format.
Okay. Okay, moving on. Madam Clerk, next item, please.
Move to receive and file item Charlie.
Okay,
Second.
been a motion and a second to receive and file it on item C. Madam Clerk, call the roll.
Commissioner O'Donnell? Aye. Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meisner?
Aye. Madam Clerk, next item, please.
Item D, discussion regarding extension of local disaster declaration.
Chairman and Commission, Tom Stolz, County Manager, regarding item D. On March 18th of this year, with the onset of the COVID virus becoming active in Sedgwick County, the Board of County Commissioners adopted resolution number 56-2020, which declared Sedgwick County to be in a state of local disaster emergency period for 60 days. That 60-day period is ending on May the 16th, and it is time to make a decision as a commission on what your intention is to move forward. Mr. Papoon and I have discussed this, and we would recommend, and I'll give you 3 reasons, and Mike may want to give more, but first of all, we would request that you extend this declaration because the virus is still active in our community. We are in a coexistence phase with it now. It is still a serious matter in this community, so a disaster declaration seems in order. Number 2, it gives us consistency with the state of Kansas. Governor Kelly still has us in a declaration of emergency as a state, so it gives us up with the state and other counties. And finally, number 3, the disaster declaration keeps the county in play for federal relief funding that is currently coming and will come in the future. So for those reasons and any other that Mr. Papoon would want to mention, we'd recommend a extension of this order.
Mr. Papoon,
Mike Papoon, County Councilor. Mr. Stoltz has mentioned 3 very good reasons to extend this order. I would also mention that there is still some uncertainty of how long the governor's order is going to be extended, and it'd be nice for many of the reasons he's already mentioned that we keep our order in place in the event that order is rescinded in one way or the other. The order protects us in some cases from liability, as he mentioned, funding. It's important in some cases to get federal grant funding, and of course it allows him to continue to have the flexibility to waive certain policies during this period of time, which isn't as easy to do when we're understaffed the way we are right now. So for those reasons as well, I'd say it's important to adopt this resolution.
Okay, and this would just be in, we're not putting a time on it. It would say we would.
That is the different, this order is different. We're asking that it be open-ended, and when the commission decides that would be brought down, it would be at that time. That way, it gives us maximum flexibility moving forward.
Well, you point out 2 good reasons, and the third one is I don't know which one's most important, but the third one clearly is a kind of a fiduciary duty for us to be able to be available for the federal future and federal fundings and state fundings and all that. So I'm in support of that. If I don't know if there's any other questions for the commission. Kershaw.
Yeah, thank you, Mr. Chairman. So just a couple questions. We've already been offered $99.6 million, and I don't know how we're going to spend that necessarily. I think we have ample funds available for the things that we're trying to do here in Sedgwick County. That money is not going to be rescinded in any way, whether we do this or not, I assume. Please, Mr. Papoon, can you please speak to that? Whether we have declaration or not, that money is ours at this time to spend for COVID-19 response. Is that correct?
That is what we believe at this time, Commissioner Howe, but this resolution would safeguard the fact of our using those funds and to be able to continue those funds and think that it's still important to have in place. But we anticipate that those funds wouldn't be taken away from us at this time.
I guess the explanation, the rationale as to why we keep this seems to me that it would be imperative that we would keep this disaster declaration until the end of the year. So at least another 7 months or so.
Yeah. That would be our recommendation, sir.
What kind of policies? You mentioned that we could waive policies. What kind of policies are you talking about?
Well, and the manager may want to address this, but you earlier gave him the authority to waive various county policies that were purchasing policies we haven't had. For instance, we haven't gone through the normal purchasing policies and bid board since the pandemic has occurred. He's been able to waive certain personnel policies, I believe. Do you want to speak to this?
No, that pretty much summarizes it, and quite frankly, we haven't used it very much. Occasionally, I will authorize purchases over $50,000. I generally will send you guys an email that we have done that. But I think as we stabilize here, we will use that less and less. But it's a dynamic situation. We don't know what a month will look like or 2 months, and it may be possible that we could even bring this down in a month or two, or we may go the other way. It gives us maximum flexibility as a county to navigate through this. And the other thing I might mention on funding, there is a FEMA stream still out there, and we have a number of cities within Sedgwick County that have their own portals to that. And it evolves weekly based on guidelines from the federal government. So I don't know that whether we do or do not do this jeopardizes that, but I think it just safeguards it if we do it.
Can you please remind me, did the state of Kansas issue the declaration before Sedgwick County or the other way around? Did we issue our declaration before the state of Kansas did earlier?
By my memory, I think she declared first and we followed very soon thereafter. I'd have to double check on that, Commissioner. I don't remember the date of the state order.
Well, just thinking back to the discussion we had back towards the middle to end of March, there was a lot of uncertainty regarding this virus.
Please mute all telephones. Thank you.
I believe that we understand a lot more about this today, and considering we're trending towards economy opening, and we have those funds available, and I assume that we could issue another declaration at any time. I'm not sure I'm in favor of extending the declaration for Sedgwick County at this time. I know we can go back and we can issue a new declaration if we need to, but since the state has a declaration that covers all 105 counties, since the state is the one that issued the restrictive orders that are basically under their control, I don't see that we have a need at this time for us to extend a Sedgwick County order. And so I'm not sure, I don't think I'd be in favor of this at this time. Thank you.
Any other comments? Okay, I'll make a motion that we extend the order as proposed by Mr. Stoltz.
Second.
Commissioner Dennis? Yeah, there's a motion and a second. Any other comments? Being none, Madam Clerk, call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
No.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Thank you. Next item, please, Madam Clerk.
Item E, discussion of the Coronavirus Aid, Relief, and Economic Security Act.
Chairman and Commissioners, Tom Stoltz, County Manager again. Item E, I apologize for the busyness of this item. We're going to be discussing several things within this item. First, Lindsay and I will give an update of current CARES strategy. Brent Shelton will then come in and either call in or take the podium. I'm not sure if he'll be here, but he will give you an update regarding the federal stimulus review team. And then we have a couple of directed requests concerning budget authority and some additional acquisitions under this CARES money, which will be presented by Lindsay, Tim, and Tanya Cole. And there's various facets that they will speak to within that. And then finally, Brent will provide you with a summary review of this of a spreadsheet of CARES eligible expenses to date, as we promised you last week, to get you up to speed on everything that we have done. I will just mention going in before Lindsay begins talking, with the CARES money, and we learn something every day from the federal government and from our consultant, Whit O'Brien, but clearly there's internal expenses within the county and then external expenses that we expect that will come from the community regarding this money. The internal expenses fall into two categories. Money that we have already spent on items that we now have to go back in and backfill general fund with the CARES money, and items that we will bring forward to you starting today of new acquisitions. And I think I heard a motion and a passing regarding the mobile testing ability. So that's another thing we'll add to the list. But those are the kinds of expenses that we will want to move forward with real time on the fly as we move forward with this effort. And then there's a series of strategy steps that we will have to go through, which Lindsay will talk about here shortly, recommended to us by our consultant and kind of recommended best practice as we move forward with management of this grant. So with that, I'll turn it over to Lindsay. I think she has a short PowerPoint to go through, and we'll go from there.
Good morning, Commissioners. Lindsay Poverso, your CFO. So I do have a short PowerPoint. Unfortunately, I forgot to email it to the communications address. So yeah, I have forwarded it to a group, and hopefully maybe one of them can send it to communications. Otherwise, I will speak off of this. The numbers are small, and so you wouldn't be able to see them up on the screen anyway, but we will get that up so that the public can see it. So we will start with an update quickly on CARES funding. We did start with $99,636,916.90. To date, $462,100 has been used toward COVID stipend pay. That was authorized for 2 pay periods, and that is no longer in effect, so that is a hard and fast cost. We have transferred $128,572.87 from the CARES funding to the general fund to reimburse actual expenses through April 29th. And so if you recall, when we had your commission meeting 2 weeks ago, we talked about that. I think Commissioner Dennis, you had made a point about that going forward, you all wanted more eyes on that. And so we authorized that action through that date. Going forward, any future reimbursement to the general fund will come to you all for final approval. So as a same part of that transfer, we did $1,788.12 back to the fire district general fund for the same type of expense. And then finally, the contract with Whit O'Brien's is a longer contract because we do anticipate relying on them pretty heavily, not just for consultation for Sedgwick County, but also consultation on behalf of any of the subrecipients who will receive dollars. A subrecipient being a city, other government, or any other entity that you all authorize to receive funding. So that is just an encumbrance. That is not an actual payment. We actually haven't even made a payment to them yet. But there is a billing schedule that they have provided us depending on who is doing the work. So we'll have an opportunity to review those invoices before we pay those. And that would be something that would come to the commission in the future. But in order to get that contract established, they required a purchase order. And so that's why those dollars are committed. So today, that leaves us with $98,894,455.91 remaining in Fund 277. So going to your next page of slides, you can see that we have spent or committed $896,414.80 within the county's general fund. You can see of that, about $488,000 is actually money that has gone out the door, and $409,000 is funding that has been committed. So you can see the breakdowns underneath that. In terms of actual expenses, we have spent $190,000 for medical supplies. That is money actually out the door for those materials we have received, and that includes testing materials, masks, gowns, gloves, hand sanitizer, maybe if it's a surgical mask, those types of things. We have spent an actual $84,000 for cleaning services, the bulk of which has gone toward the sheriff's office, or for the sheriff's office, for the jail, for their space here on the 3rd floor, also to clean out their squad cars and that type of thing. We have spent another $54,000 on operating supplies. The vast majority of that is for rental for the large drive-through tent that's being used on West Central for the drive-through clinic. We have another $39,000 that has been spent to support telework operations. And so that includes everything from laptops to webcams to mice to cables, those types of things. We have encumbered, meaning we intend to spend but have not yet received the items, $239,000 for medical supplies, again, gowns, masks, swabs, that type of thing. Another $92,000 has been committed for management services, and so that is primarily for financial support. If you recall, very early on in this, before we heard about CARES Act funding, we engaged an entity called Disaster Recovery Services to assist us with doing FEMA applications, and they actually will manage that for us, make sure the messaging is correct, make sure the documentation that we put together is the way FEMA prefers to get that and reimburse us. So that was already in place. We also have engaged the services of an external grant writer to help us find opportunities and seek them. And Commissioner Howell, to your point earlier about that $99.6 million, we do have that and it is readily accessible. There are quite a few strings that come with that, and we also are hearing some discussion that potentially there will be some preference order about what type of funding we spend. And so to the extent we may have some additional grant opportunities that either provide greater flexibility or maybe it's a preference order. I know Treasury is still working on what that looks like. That may be another opportunity for us to use that grant writing service to help us prioritize that. The next couple things that are listed there are smaller amounts, $19,000 for glass barriers to be put up at customer service stations, particularly in the elected offices. And then I know Tanya Cole, of course, is coordinating with the rest of us now to figure out exactly what we will need to reopen to the public, and so that is upcoming expense. And then another $17,000 for custodial supplies. We are buying an awful lot of disinfectant and an awful lot of sanitizer materials, but a lot of it is hard to come by right now, as I'm sure you've heard the issue with Clorox wipes. So lots of orders out there. Hopefully we'll start seeing some of those trickle in. So within the Fire General Fund, we have spent actually $22,000 with another $400 encumbered. The bulk of that was to purchase both N95 masks as well as a machine that will help them fit appropriately to the staff member who's actually using that. So, and then we have some additional equipment that we're still waiting on to come in for that, and that's what's encumbered. So, if we look at all of that, slide 2 and 3 together, that brings us to a grand total through last night of $1,660,780.31. So that is where we stand today, and as we seek any future reimbursement, we will bring that to you for approval before we make any such transfers. So I don't know, Tom, do you want me to talk through the next steps, or would you prefer to do that? Okay. So we have engaged Widow Bryan's. So far, I have been exceptionally impressed with their level of responsiveness, and they have done some great work for us. I sent in a request about noon yesterday and had a response by 6 o'clock last night with a 4-page response of trying to find out if we could get reimbursement for certain activities. So certainly they seem to be holding up their end of the contract. The other item that they're working on as the highest priority for us this week is understanding that you all are receiving requests frequently about how this $99.6 million is going to be used to support the community. And so they actually participated in a call for NACO a couple weeks ago, and in that discussion they recommended that any entity that is going to have subrecipients, so not the entity itself is not going to keep everything, that they develop a strategic plan. And so the first step in the strategic plan that they have proposed, that Widow Bryan's has proposed that we do, is basically put out a notice of funding opportunity to the community so that we can understand what the needs are. There are a lot of restrictions in with the CARES funding, but it's also, there's quite a bit of flexibility in there for elected officials to determine what's reasonable based on their own community's needs. And so our program could look very different from what others are doing. So they are helping us put together that notice of funding opportunity for us to put out. We will get that information back. I believe they are working on a technology solution for us, or we'll have some recommendations at least for us to consider so we can just buy something off the shelf, recognizing that we don't have time to build something from scratch. So once we get that information, they have recommended that we use that to recommend a strategic plan. And within that strategic plan, we are encouraged to focus on 3 to 4 areas, program areas. So maybe response, and within response, maybe that means making sure that all of the first responders in the community have access to the PPE they need. Make sure that there are masks where we have our public buildings where we are having folks come in, things like that. And maybe other program areas as well. So they will look at what those are and make some recommendations for us also, maybe help us come up with a menu of options. We'll bring that to you, and that will kind of give us our boundaries, for lack of a better term. What exactly are we authorized to fund? That will also help your federal stimulus review team to know kind of when things come in, not just is it eligible for CARES, but is an eligible expense under what the commission has said. So once we have that, those program areas, they encourage us to identify specific dollars to go with each of those funding streams. And they have been very encouraging of having what they call a strategic reserve. So maybe there's a need we don't anticipate because these dollars are supposed to last us through December 30th. And so they're encouraging us to hold back at least a certain amount, and that will be set by you all with some recommendations from them if that's what we want, so that we make sure that we are in a position to accommodate anything that may come forward. That next step then will be to train the county staff to act as a grantor. So we do have pockets throughout the organization that act as grantors, but nothing to the tune of the dollars that we're talking about here. And recognizing that the county is liable for any misuse of these funds, we have already heard that the Inspector General is planning at the minimum desk reviews to look at all of our expenses. We know that our financial auditors will be focusing on this in 2020 for the 2020 audit to make sure we do it correctly. So we need to learn how to do it. We need to learn how to then train our subrecipients so that they know what to expect. They can put together the appropriate documentation to protect themselves as well as subrecipients of those dollars. We also then will need to have some training for the federal stimulus review team so they also understand the expectations and the rules, the guidelines. And then we will need to start preparing, depending on what the program areas are, on how to train those subrecipients, on what documentation, what application process, what they do with the funding when they get it, how they report on it in their financials. So there's going to be a lot of moving parts to this, and unfortunately none of it's going to necessarily be easy for any of us. But the great thing about this is we're getting training so that we protect ourselves and others. The next step then would be to actually perform risk assessments on the potential subrecipients. So let's say, for example, the city of Wichita comes and says, you know, we've spent X many dollars on personal protective equipment for our police officers, and we want reimbursement for that. One of the things we will need to make sure that we have done is we have looked at their financial audit, their comprehensive annual financial report, look at their management letters, identify if there are areas of risk, and make sure that we take appropriate action as the grantor to make sure that those are mitigated and we feel comfortable and that you all are comfortable with how those dollars will be managed. Next will be then, of course, a process to identify how those funds are going to go out. And that will be something that both Widow Bryan's and BKD play a role in assisting us in making sure that that is done responsibly and accurately. The next item on the to-do list is then to develop the forms and the formal process by which the county will accept applications for reimbursement. We are hoping to have that electronically as much as possible, recognizing that we may need to accommodate that not everyone may have access to that. And so that is something we'll take into consideration as we move through, as well as what will the monitoring and reporting responsibilities be for those entities as well as us. And that doesn't just mean reporting back to the feds. Right now there's no reporting requirement on that. But what do you all expect from staff? And what kind of monitoring of those subrecipients do you expect to hear back? And then finally, we will develop a tool to provide the recommendations from the federal stimulus review team back to you all so that you feel like you have the right amount of information to make decisions to say, yes, go ahead and reimburse that, or no, I'm not comfortable with that. We need X, Y, or Z information to do that. So that's where we stand in the process. I know it feels like things are going slowly, but I cannot begin to tell you how much time we are spending on the phone and looking at records, trying to understand how to do all of this in a responsible fashion. So we do have some asks for today.
Lindsay, before we start on that, could we is there any questions, commissioners, on what we see as next steps? And I might just bring to your attention that the notice of funding opportunities is going to be our first contact with entities outside of Sedgwick County to begin to gather ideas on what they see as needs. So that will be happening fairly shortly, just for your knowledge that we will be putting that out probably sometime next week. Whit O'Brien will begin to give us some parameters on that, and we're going to try to make this as slick as possible to where we can do it with an online tool. So that we don't have to be getting letters or papers in, recognizing, as Lindsay spoke, though, some people may not have the mechanism to do that. I think most of our initial communications will be with other governments and townships, and then any other parameters that WIT gives us to move forward with that. So that will be happening soon. So I just want you to know that that will be our first contact with outside the county players. So questions on the process or things that we could answer?
Commissioner Dennis.
Thank you, Mr. Chairman. Well, as we've been told several times, if we don't spend this correctly, they could ask for reimbursement at the end. So I don't know what we signed that said we would do that, but if we provide any funding outside of Sedgwick County, we need to request them to give the same certification back to Sedgwick County that if this is determined that it not to be an allowable expense, that they have to reimburse Sedgwick County.
Good point. I think Brent was on I think GWP just hired if you've got a grant writer idea yet, because.
We have one engaged who's been working for us for several weeks now.
Okay.
Just for the county exclusively.
Okay. Because there's a company that does it for municipalities, government agencies. I think they were local or regional. I think they're regional out of Kansas City or somewhere, weren't they? But okay. Well, if you're happy, then I just wanted to make sure that that you do have that engaged. Okay, Commissioner Howell.
Thank you. So for our cities across our county, if I understand correctly, our relationship with them is they have to spend the money as they apply for reimbursement. So we're not giving them money that hasn't been spent already. In other words, we're just reimbursing their expenses.
Correct.
Is that correct? Is there any chance that we could spend money on their behalf? If they were to make a request through the county, could we spend money on their behalf so they don't have to do that?
I think anything is open right now, as long as we can validate when it's going through that process that it's accurate. So I think we could look at changing the way we ask them to apply.
I agree with Commissioner Dennis. As long as it's clear that they are responsible at the, in other words, through the audit process, if there's ever something that was spent that should not have been spent, that they would have to pay us back at that point. But I don't mind necessarily trying to find a way for us to spend money on their behalf so that they don't have to front load, if you will, those budget items, because that could be a very big hardship on them. Maybe a deterrent for them to spend money at all. I think that they ought to be empowered, if you will, to get access to those funds on the front end. So if they have an idea, as long as we agree with it and it gets through the Whit O'Brien process, our committee, I guess, approves their expenditure idea, we ought to front load that idea, maybe do spend some money on their behalf that would benefit that community.
We can ask Whit O'Brien's if there's opportunities to do that.
I think that's a better way to go forward if possible. Thank you.
Okay, I'm glad that you're personally impressed with Whit O'Brien's response, and tell me, you recall how many clients do they have now around the country?
I don't know the precise number, but a lot. They have been telling us about a number of the folks they've got in California and Colorado as some examples that we've actually spoken about in discussion.
Okay. Well, I like the direction there's this request that they're putting together to help us say what's good for our community versus what might be going on in Denver, whatever.
Absolutely.
It's good, a little scary that we get to make these decisions, but
It is.
as good as we can get, that's all we're going to try to do, the best we can.
So we do have some, sorry.
You need a motion for this last part
Well-
for the past expenses and budget authority.
So we actually have Tim and Tanya lined up to come and give you some briefings on this slide.
Okay,
And then if
okay.
that's okay, we'll ask for a motion at the end of that. Is that
That's
okay?
fine,
Okay.
that's fine.
Tim, you want to come talk about health department position
I
asks?
didn't want to cut it out. Does anybody else have some questions so far? It's really good information that you've updated us with. I appreciate it. Lacey? Commissioner Cruz?
My question, I guess, would be, you know, when we talk about determining a strategic plan on how we're going to administer requests for funds, you know, I'm just not really in the, I just don't want to have to pick winners and losers. And so I think it's really, we have to really communicate to everyone exactly, you know, how this money is going to be effectively dispersed. So is there a communication strategy around this, and how will we be, is that going to be part of the strategic plan as to how we're going to communicate this to the community so that they fully understand how this is going to work?
Yes, ma'am. So actually maybe two, if I can answer in two parts. So the first opportunity for the community to get engaged is going to be that notice of funding opportunity, where we're basically reaching out and saying what are the needs in the community. And so that will be part of what Widow Bryan's includes in their proposal to us or recommendation to us is how we go about getting that engagement. So that will be step one. And step two will be once you all have determined the program areas based on that needs assessment, we'll need to make sure we're communicating that to the right people so that they understand that there's this funding opportunity. And so that will be a secondary strategy. And yes, that is certainly on the radar for all of this. And once it's appropriate, we'll work with Tanya's team to make sure that we can get that out, get it on the website, get it on social media and everything else we can possibly think of.
Okay. Thank you.
All right. Tim, will you
Next up.
please
Okay,
come
and-
talk
and-
about health department?
So Tim will now talk about some health department asks by using CARES money. Tanya will follow him with some marketing communications ask, and then Lindsay will bring the podium back to kind of summarize the asks that are what we're wanting you to do today regarding budget authority. So, Tim?
So the first bullet point on your last slide talks about an ask for $1.8 million for temporary positions to support the COVID response. The incident command system has been in place for 10 or 11 weeks now, so quite a long time. And as I mentioned during the budget presentation, there were over 100 folks involved in that incident command structure to respond to just on the health side. And adrenaline will carry you for quite a while, but at some point in time you have to recognize that we need to settle in for the long haul, and we need to add some staff so that we can fully support that. Because what we've done to make that incident command structure work right now is we've pulled health department folks that do all kinds of different work, and they're focused solely on COVID-19. And so we need to allow them to, some of them need to go back to the work that a grant may fund them for, because when most of the funding for the health department comes from the state. You're going to hear from Adrian about that a little bit later as well, but they give us that money in exchange for specific outputs that we need to deliver. And so we've got staff that are doing COVID work right now. We need to get them back to the work that we've hired them to do. And so we have put together a list of 47 different positions that we need to add to help support us through the end of the year so that we can fully respond to the COVID-19 issue. I've kind of grouped those in categories to help you understand what types of things we're looking for. We've already, more than a month ago, we knew that we were going to need more folks involved in contact tracing, and so we added 2 epidemiologists on a temporary basis a few weeks ago. So now we'd like to add 47 additional positions. 12 of those will be related to contact and case and contact investigation. So we're going to add 7 disease investigators, and 3 senior disease investigators, and then an epi and a fiscal associate to help us manage all of the information that needs to be processed when we identify someone who tests positive. Then there's a number of steps that have to be taken after that. And so 12 of those 49 total, but the 47 that we're asking for today would be tied to that. 5 of them will be data analysts, because we've got a lot of information that's coming in. We're gathering more information every day, but information is what allows you and the health department and the health officer to make decisions going forward. So we know that we need to add some folks that can do just data analysis and provide that information to you and the community so that we can move forward. 20 positions are related to testing, the bulk of them to that drive-through site. There are times already that we do some off-site specific locations. Primarily up to now, that's been long-term care facilities where we'll send staff in to do a sampling in that location. But we would add 20 positions. The bulk of those are going to be nursing staff that will help us. It's also people that are going to help on the medical triage line. Those are nurses as well that help people understand whether or not they're appropriate for sampling. We've got 4 folks that are tied to what we call community support. So they're folks that help manage the health department call center. And then we provide information and guidance and to industries right now. So we've got organizations that call the health department and ask about what's the appropriate PPE that they need, what's the appropriate distancing, how do they manage their operation in this new environment. And so we need some specific staff available to that. And then one of the community support folks is also going to manage our quarantine stuff, because when people go into quarantine, we've got to be able to track that time and where they're at, all of that. So that's part of the support. And then there's 8 more what I think of as kind of back office administrative support positions tied to logistics, acquisition of equipment, acquisition of hotel rooms if that's what we need to do for people that go into isolation, and safety officers, communications folks. We want to continue to do health education on this topic. And so that gets us to 47 positions. These are all positions that are temporary positions. We would like to have them available to us through the end of the year. November, December timeframe, we'll start to figure out what the duration may be. We know that the CARES funding right now is available through the end of the year. If that gets extended, if the need extends beyond that, then we'd come back, talk to you about extending the duration of those positions. But that's the ask today for the health department. We'd like to be able to post these positions and start to fill these positions and allow some of the staff, about 17 staff in the current incident command structure, need to go back to the work that we've hired them to do originally, and then the other 30 are really tied to the increased workload that has come about because of this pandemic. So I'd be happy to answer any questions.
Commissioner Dennis.
Thank you, Mr. Chairman. A couple questions. We've got how many furloughed right now in Sedgwick County?
I think the number is 200 some, somewhere in that range.
And none of these 200 and some are qualified to go back and help you in that? I would much rather use our employees than to go out and try and hire more people and still leave people on furlough.
Do some quick math here. I'm thinking 35 to 40 of them are really specialized healthcare providers, and so we don't have anybody in that category that's on furlough. If you're a healthcare provider,
well, that brings up my second question. I'm kind of worried. Your disease investigators, contact tracing, and so forth. I can't believe that we've got a plethora of those sitting out in Sedgwick County that aren't working right now, because everybody is involved in this. The hospitals are full up. Everybody is concentrating on this, and you believe that we have people in the community right now that want a temporary position that are qualified to do all this, or that we couldn't train some of our people that we've got on furlough currently?
I asked those same questions of our staff in the health department, and they indicated that, particularly around the epidemiologists, they indicated that based on we filled 2 of those positions that I mentioned we had asked for about a month ago. The response was really good, and so they believe that there are still people out there. We've got folks that are maybe medical school, they're bound for medical school, but they're that's a little bit up in the air right now, so they're available. There seem to be a number of medical specialists in the community right now that would be available for the short term. The other thing that we know is that there are specialty hospital or specialty healthcare providers that have either dramatically reduced or completely stopped providing services during the shutdown. And some of those folks are available right now as well. So we think that we'll be able to find them. Now, I do agree that if we've got anybody in the community anybody in the county that's on furlough that would be appropriate for one of these positions, we'd be glad to slide them into it. The other advantage to creating these positions is it clearly identifies the salary expenditure for our finance folks to tie it back to CARES money, because we want to make sure that these positions are funded with CARES money. So if we create the positions, and even if we're moving current county staff into them, it would allow us to track that money a little better.
Okay, well, my first responsibility is really to the public, but second of all to our employees. And I've said it for 3 years that I've been on the commission that our 3,000 employees are really very high on my list of priorities to make sure that I take care of. And I want to make sure that those are our number one considerations when we're looking for someone to fill these positions. I'm not opposed to it. I just don't know how that we can find these positions. In addition, as you said, we're going to look at people that have been laid off from jobs, but those are coming back as soon as we get into phase 3 and 4 of the governor's order, and they're going to be wanting a permanent position, not a temporary position. So I want to take care of our people. If we can train them to do contract tracing and so forth, we need to look at our folks first.
I agree.
Thank you.
Commissioner Cruz.
Thank you. So these positions, be it on a temporary basis, but are these going to be 40-hour a week, or like what is are you going to let them, what's the hourly? I mean,
The bulk of them will be full-time.
okay.
There may be a couple in there that are not, but I think the vast majority are full-time.
So will this 1.8 million just be for salary? There's no benefits with this?
Some of we'll benefit these positions because they're going to because we want to make sure that we're an attractive employer.
Yeah.
And to speak to both of those questions, we will that would include benefits as well.
Okay. That's it.
Commissioner Howell.
I am interested also in, once we get to the end of the year, if this money, if the CARES money is paying for these folks to have salary and benefits, it's understood then that at the end of the year that they're going to be terminated, I guess, because that's when the money runs out. Is that right?
Correct. Yeah, that would be the end of their appointment.
I would think that we would want to use contract employees for this, so that's understood. I mean, most contract employees are for about 6 months. It seems like it's going to be difficult to find people and to place them. We have to go through orientation. We have to set up office space for many of these folks. There's a lot of challenges of getting people hired through our normal process. I think if we were just to contract this, it might be a little bit easier. Typically, that money you put out for contract employees includes their benefits. They get that through the contracting company. So I would think it'd be a little bit cleaner to do it that way.
I'm not going to answer on behalf of HR because I get in trouble when I do, but I think there are some issues related to the type of, we'll certainly talk to Sheena and her staff and to Lindsay and her staff about what's the appropriate staffing level. I believe that there are some challenges in contracting for this type of work, but I can't speak to that. I guarantee you that we'll give it full consideration.
I just think it's going to be difficult for us to find 47 people. We only have 6.5 months until this money is expiring, if you will. And 6.5 months for us to advertise and then to interview and then to hire and then to place. We probably have office space challenges, I'm assuming. I'm not sure where they're going to office out of primarily. So I guess I have some concerns about trying to find that number of people so quickly, and then them knowing that their job is very temporary, and if a few months down the road they're going to be terminated. That seems like a very difficult challenge to me. All right.
Well, I would only add that I mean, you make a decent point, but there's a lot of talk going on in Washington about a lot of things, but there may not be a hard, fast deadline. December 30th could come and go, and everything could be extended as well. But I mean, that's a bunch of what if that we're all talking about. So
Well, let me just add, my experience in the past has been, of course, in the aircraft companies, and when I see people come in when things are really time pressured and there's a lot of work to get done, they'll bring in some contract folks that are very, very high skilled, very high level, very specialized engineers, for example, to come in and do very specific work. So it's salaried type work, but they're being paid very high salary for a very short time, and they know that coming in. And that's typically what I've seen in the past. And in 6 months, when that pressure is over, it's understood that they're going out the door. So they come in, they go very quickly, but it's very specialized staff. And so when you have a huge challenge like this, that contract labor typically has been really good for aircraft companies, and that's what I've seen in the past. So, thank you.
Commissioner O'Donnell?
Yep, thank you. Tim, I think one of the areas we need to find some benchmarks to make sure that we're not spending an inordinate amount of money on overhead. That we need to say as a county that we want 90 cents out of every dollar to make sure that we're going to actually treating it and not just hiring a ton of people. Do we anticipate this $1.8 million is going to be all that we are going to need, or are you anticipating coming back to hire more and more people? Because I think this is the frustration with the citizens regarding government, is we just hire and hire and hire and we don't actually do anything. And yeah, my mic's on, I'm just making sure. But that's what's really going to torque me off if we just spend millions of dollars hiring people and they're not actually serving the public. So we need, as a commission, to come up with what we believe is guidelines and benchmarks to say we want 90 cents of every dollar actually going to treating this, or 95 cents out of every dollar. We're already at $2 million here, so we're down to a little over 98 large to continue the correct nomenclature. I want to make sure that we're not going to continue to bring more and more personnel, because the goal of this money is to treat COVID-19. It's not just to hire people.
I would agree, and I would tell you that I don't believe that anybody that I promise you that the folks that we have right now that are working crazy hours. They're working well over 8 hours a day. They're doing all kinds of work to respond to this pandemic right now. And the reason that we've asked for this number of positions is because we believe that's what we need to get us through the end of the year. I don't believe that we would anticipate coming back with additional requests for more positions, depending on how things go and whether or not this funding is available. We may be talking about extending it after the 1st of January. But for right now, this should meet all of our personnel needs for the rest of the year.
Okay, thank you.
Richard Cruz?
Thank you. I think we can't hire people if we don't have the ability to do it. And so I appreciate your efforts in kind of road mapping all of the people that to be ideal. I mean, obviously you can't hire anybody unless we have the approval to do it. So I think that this is a first step. Obviously we might get maybe 6 disease investigators instead of 7. But I think we have to start somewhere, and I think that's exactly what you're doing here. So I have to, trust the public health officials that have been doing this for a very long time, and I put my trust in you to come to us with solutions that you believe are the best use of this funds. I don't think that you guys are doing anything that you wouldn't recommend would actually be to combat this virus. So I am supportive of this. We might have trouble filling them all, but we can't fill them unless we have them available to fill. So I am supportive of this.
Okay, well, we can take each 1, 2, 3 separately, or we could wait and vote on them all. But since we've had a lot of discussion about this one, I think regardless if it's official county employees or contract, you still need a budget amount to move forward. And so I think you can follow up with HR as to why you chose. And but I'm supportive of this portion of funding. So I'll make a motion to approve this temporary position to support health.
Second.
Commissioner Dennis.
Thank you. I would support it with one caveat, that we give preference to our furloughed employees, because I don't understand why they couldn't do things like admin support, logistics, procurement, community support, testing, data analysis. I don't know that you need a trained medical person to do a number of the tasks that he stated. So if you'll amend your motion to say that we give preference to furloughed employees, I'd be supportive.
Why don't you just make a substitute with that?
I'll make a substitute motion then to support items 1, 2, and 3 on the agenda slide today, with the caveat that we give preference to furloughed employees from Sedgwick County.
Second.
So we're not taking them one at a time?
So you want to approve 2 and 3 also, which is fine. I mean, it's a smaller amount.
I don't have a problem with approving all 3.
Okay.
I don't.
Okay. Yeah, because the furloughed employees, they'll have to make their own decision if they want to take the spot, knowing that it might end.
I
December
agree. It'll be up to
31st.
those
But yeah,
employees
right,
whether.
okay.
But
That's fine.
I want to give preference to our employees.
All right, I'm supportive of that. Commissioner Howe?
Thank you, Chairman, and I agree with the comments of Commissioner Dennis. I'm a supportive of the motion. I want the health director and the health department to have whatever staff they need, obviously, so I'm very supportive of that. I do think that our employees ought to have preference. I think that's an excellent point that you made. I do have a question about the public awareness campaign. Can you talk about how much money we plan on spending there, and what's the strategy, how we're going to do that?
I'm going to turn that question over to Tanya.
And I have one more, and after that, I have one more question, one more question on the elections money, but go ahead.
Good morning, Chairman and Commissioners. Tanya Cole, Assistant County Manager. So as we are in phase 1 of the recovery plan, I think it's important that we as the county work with the community and put out a public awareness campaign basically on safe practices. And so what we need to work on is those safe practices being wearing masks, social distancing, washing hands, staying home when sick. Basically the things that Adrienne Byrne talked about last week when she talked about the health and economic recovery plan. Some other things that I think we can talk about as well in this public awareness campaign is, Commissioner Dennis, what you proposed about the mobile testing. That would be another opportunity for a public awareness campaign. And then as well, what Tim just talked about, I think we could help him with recruitment and hiring of those 47 positions if it's that many, depending on what we do with the furloughed employees. And so the request is for $25,000 to look at various media platforms and outreach. And I think we can, there are some opportunities for community partnerships as well as part of this public awareness campaign. But the request is for $25,000.
And do you anticipate this would be the television, newsprint?
Everything.
Everything.
Everything. Television, social media platforms, radio, paper. I mean, any type of platforms we can use, we will use.
All right. Well, that was my second formal request to the manager last week, so appreciate that it is on the list. And then can you talk about the election cares funds from Secretary
I cannot.
of State?
I will turn that over to Lindsay.
Thank you.
Hello again, Commissioners. So Tabitha Lehman advised us that the Secretary of State's office had determined how it was going to allocate the funds that they received from CARES. So they actually received additional money over and above the coronavirus relief funds, which is what we've been talking about. So separate from the $1.25 billion that was allocated to Kansas. So the cap, the lid, that she has been told for Sedgwick County is this precise dollar figure, $420,307.37. And so the way that works is the Secretary of State's office is doing it similarly to how, at least initially, we had envisioned doing this, where we have to spend the money first and then get reimbursed. And so what we would propose to do is within our stimulus fund, create a separate fund center, a separate program in there, where we would give Tabitha this $420,307. She would use that based on the rules and guidelines that the Secretary of State's office has put out about what's reimbursable. Spend that money, and then up to $420,307.37 would be reimbursed to us after the fact. And so that's what we're asking for, is to give her the ability to spend that, not in the county's general fund, and then seek reimbursement.
So this is in addition to the actual, if I understand correctly, the SOS also ordered a PPE that he plans on distributing to the various election offices throughout the state.
Yes, and I believe it's maybe not as much as we think we may need for the number of polling sites we have, so
Right.
it could be used for that or to bolster other things.
So this $420,000, that would be on top of the $99.6 million that we
Correct.
were already offered.
Yes, sir.
So we're over $100,000 from the federal government, if you add all that up.
Yes, from Just CARES specifically.
Okay. Well, I'm very supportive of that as well. And I think that if she needs more than 420, if that's what the state's offering, of course, she can make an argument and get whatever she needs under the CARES Act through the county.
Sure.
So that's fine. Thank you very much for the answer. I'm very supportive of the motion this morning. Thank you.
Okay, so just in summary, our total ask then is that 4.2 million that's listed there at the bottom. That includes all three discussions you all have had today.
Correct.
Tim's positions, the ability for us to shift costs out of the general fund and directly to the CARES fund, because at this point, we're just simply eating up budget authority, and it's May, and we don't necessarily want to spend all $99 million out of the county's general fund and seek reimbursement. We want to try and direct it to that funding source, and so we need you all to establish the budget authority for those three things. And then again, as we seek reimbursement to the general fund or the fire general fund, we'll come back to you. So that's
Okay.
my recommendation.
Yeah. I think that is encumbered or included in the motion overall.
Okay.
Okay. Substitute motion, as stated by Commissioner Dennis, and I think it was seconded by Commissioner O'Donnell. Any other questions? Being none, Madam Clerk, call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye.
One more thing on this item, Chairman Brent will give you an update on the review team and also give you some spreadsheets on how we're going to track moving forward. Just some house cleaning here.
Brent.
Good morning, Mr. Chairman, members of the County Commission. I'm Brent Shelton, your Deputy Chief Financial Officer. Here this morning to visit a little bit about the financial stimulus review team that is being compiled to help assist us in spending the external requests for funding that we will anticipate receiving from other local governments in the county. And I stress that it would be the external funding request because just like the internal funding that you've just approved, those encumbrances and those expenditures that are for county expenditures would not go through this group. This group will be looking at external requests only. Now, we've put together a group of 7 voting members on this committee, and they are comprised of 2 staff members, be myself, Hope Hernandez, your accounting director. And then the other members of that committee are Jane McHugh, who's a retired certified public accountant. She's a retired partner with BKD. Melody Miller, who is a former county commissioner and former state legislator. Mark Manning, the budget director for the city of Wichita. Kyle Mangus, who's the deputy city manager for the city of Derby. And Melissa Walker, who is a assistant professor at Wichita State University and is currently serving as the director of the Hugo Wall School. So we found a group of folks that have some community involvement as well as experience in working with government funding and government finance. 2 other non-voting advisory members on this committee will be Lindsay Poe-Rousseau, our CFO, and Kevin Stamper, Assistant County Counselor. In the conversations that we've had with this group, to a person, they have been very supportive of what we're doing here. They appreciate the confidence that's been placed in them in moving forward with this, and they are looking forward to the training and so forth. We've talked about the time commitment. I think we can foresee coming to you on a weekly basis with expenditure requests from the external community partners. So they do understand that. They're looking forward to the training that would be provided, and we would bring them into the process about step 3 on the process that Lindsay outlined for you earlier this morning. I envision that group would meet. They would be looking at these external funding requests. They would then make recommendations based on guidance from our internal counsel as well as Whit O'Brien on the appropriateness of those expenditures and making those recommendations for reimbursement. Once they've done that, you will know that when you get those recommendations, they've been fully vetted by the committee. They'll have been reviewed by Whit O'Brien for appropriateness. We're going to feel like they're legal, sound, appropriate reimbursements before they come to you. There'll probably be some that'll get weeded out in that process that wouldn't make it to you for final approval. Once it comes to you for final approval, begun a first iteration of kind of a summary spreadsheet of what we would be presenting to you on an as-needed basis for your approval. And basically what we're trying to do with this format, and if you want something else included in this, just let me know, because I want to give you the information that you need to make those decisions. But we want to start with where we started, the total amount of money that we began with, any interest or investment earnings that money's made. And then we want to tell you what's been encumbered or spent, both internally and what may have been already approved previously for one of the external reimbursements. Give you a picture of what's being considered today with backup information. And then finally, if those are all approved, the remaining fund balance that we would have in the CARES Act fund. So it'd be a complete snapshot every time that I come before you to talk about those expenditure reimbursements, summarized, and then we go into the next summary spreadsheet would follow from there. So that's kind of where we are at this point in time. Again, we're excited to put this group together. I think we've got a good group of diligent people that can help guide us as we go through recommending these external funding. With that, I'll answer any questions that you might have.
Okay, well, that looks like a plan. I'm glad. Thank you, the committee members. That's going to be a lot of time, and I can't thank the committee participants and for their dedication over the next X number of months. So thank you much. I like the format. So each week it'll be dated, and you'll be summarizing, and so okay, I'm good with that. Questions? Yeah.
Just 2 questions. So what's the official name of this committee?
It's the Financial Stimulus Review Team.
And my next question is, I guess, to Councilor Papoon, do we have to do anything in terms of a resolution to officially create this committee and to recognize them as appointed members?
I believe the action that was taken at the last meeting would have covered that. We can obviously come back with a resolution if we need to do that, but I believe the commission approved this committee last week. I think we did too.
All right, thank you.
Okay, do we need to receive and file? Okay, motion to receive and file. Any other comments? Thanks again, Madam Clerk. Oh, Commissioner Dennis, did you have a comment? No, okay. Madam Clerk, call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Thank you, Brent. Madam Clerk, next item, please.
Item F, consideration to amend the aid to local grant application previously submitted to the Kansas Department of Health and Environment to include additional state formula funding allocation provided by Kansas legislation for infrastructure at the Sedgwick County Health Department.
Okay, before we get started, I'm going to request about a 5 to 7 minute break. So we will return just shortly after 11 o'clock. Let's say 2 or 3 minutes after 11. Thank you. Okay, we have returned from recess. And again, thank you, commissioners, for the in-depth discussion and our updates on the COVID-19 world. And so now let's get back into the real business of the county, and let's get our business hats back on and bust through it. So thank you.
Okay. So good morning, Commissioners and Board of Health. Adrienne Byrne, Health Director. So before you is an amendment to our annual aid to local grant that you approved in March of this year. Last month in April, our state health department announced that Kansas legislation approved 2 proposals to increase the allocation of state formula funding based on inflation and county population size. State formula funding is state financial assistance to local health departments to help with our infrastructure. It's the first increase of state formula funding since 1992. Sedgwick County received an increase of 32%, or approximately $111,000. I'm requesting to use a portion of this funding to add a position to our staffing table for an epidemiologist. I recommend approval of the electronic submission of the amended grant application, authorize the chairman to sign all necessary documents, and authorize implementation of staffing table changes identified in the personnel considerations section of this request. Be happy to answer any questions.
Any questions? Okay. Thank you, Adrienne, for the information, and entertain a motion to approve. So moved. There's a motion and a second to approve this item. Being no other discussion, Madam Clerk, call the roll.
Commissioner O'Donnell? Aye. Commissioner Dennis? Aye. Commissioner Howell? Aye. Commissioner Cruz? Aye. Chairman Meitzner?
Aye.
Thank you.
Madam Clerk, next item, please.
Item G, presentation of the 2019 Comprehensive Annual Financial Report.
Okay. I hope and understand that we have an auditor is available on the call as well.
Good morning, Commissioners. Hope Hernandez, your Accounting Director. Before I present the 2019 CAFR, I'm going to let John Cotrera, a Director at BKD, brief you on the 2019 audit results.
John, are you available?
You're muted.
Okay, I'm muted. Hold on. There we go. John, are you available? Are you on the line?
I am here, yes.
Okay, I think we can all hear you all right.
Okay, perfect. So, good morning, Commissioners. Thank you for having me here this morning to go over the 2019 CAFR, the results of the 2019 audit. And thank you for giving us the opportunity to serve the county in the capacity as your external auditor. This is our 4th year that we performed the audit for the county, and although the county did experience some turnover in the finance department, I think you'll see that it was a smooth and efficient audit this year, no big surprises, which is obviously the goal in an annual financial audit. So I'm here to discuss the results of the 2019 audit and again, address any questions you might have, but I'm not going to get really into the nitty-gritty in terms of the detailed financial statement balances, as I know Hope has a pretty detailed presentation that she's going to cover once I discuss the high-level overview of the audit process. So as part of our audit process, we provide 3 main deliverables, which I believe you've already seen and been able to review. The first of which is our opinion on the CAFR. The second of which is our required communication with those charged with governance, which is obviously the county board in this instance. And then finally, that single audit report, which is required due to the fact that the county expends more than $750,000 in federal grants. That was obviously the case in 2019, and that will certainly be the case in 2020 based on the previous agenda items you all were discussing as it relates to the CARES Act funding. So the first report that I'd like to discuss is the largest of the three documents, which is the CAFR. Now, the CAFR is broken up into three different areas, which is the introductory section, the financial section, and the statistical section. The CAFR is produced internally by the county's finance department. Our responsibility as it relates to the CAFR is to provide an opinion as to whether the CAFR is presented in accordance with generally accepted accounting principles. That opinion can be found on the first page after the financial section tab. And I'm happy to report this year that the county received an unmodified or clean opinion in the current year, so no concerns from that perspective at all. And this is the same type of opinion that we provided in the prior year. However, one thing you will notice if you were to compare the opinion to last year is that there's an emphasis of matter paragraph just below our opinion paragraph. And that paragraph was added simply to point out the fact that the county implemented a very significant GASB statement in 2019, which was GASB Statement 84. GASB Statement number 84 on fiduciary activities was a pretty significant standard for most governments, the county included, and it deals with the classification of the county's fiduciary activities. It actually resulted in a new fund for the county being reported, and also some other changes in classification for some of the agency, what were previously agency, now custodial funds for the county. That emphasis of matter paragraph does not modify our opinion in any way, but again, it's just meant to specifically call out the county's implementation of that significant standard. Directly after the auditor's report is management's discussion and analysis. This section of the CAFR is written by management and is really meant to provide the reader with a clear, concise summary of current year results, along with commentary describing the reasons for changes in the current year. If you haven't had a chance to read through the CAFR, I know it's a pretty large document, I would definitely encourage you at least read through the MD&A, as it provides you with a very good executive summary of the entire document. As I mentioned, I won't get into any more details on this report, as I know Hope will begin really into the nitty-gritty on it. But as it relates to GASB Statement number 84, I just wanted to point out that on page A29 and A30 of the CAFR, these are the statements that were most dramatically impacted by GASB 84 implementation. And you'll see on page A29 that the county is now reporting a new fund here, which is the section 457B plan. So this is obviously not the county's funds, and it's not something that you have available to spend, but funds for which the county is acting as a fiduciary for, which GASB 84 required be presented as an other employee benefit fund. The following page A30 is really just the flow statement for the new fund and the newly classified custodial funds. Again, those custodial funds were your agency funds in the prior year. Again, you're just acting in custodial nature for these funds. Last item I'd like to call your attention to on the CAFR is page A72 of the report. So that again is going to include an enhanced note on the implementation of GASB Statement number 84. There was actually a restatement to beginning that position due to the classification of one of the new custodial funds, the Sheriff Inmate Trust Fund. So we explained that. And also on page A72, obviously our report is dated, is as of, the balance is as of December 31, 2019. And then the date of the report is actually the end of April. So from that period of January 1 of 2020 through the end of April 2020, we are still required to perform subsequent event inquiries and assess any significant subsequent events for the county. And the accounting team felt it would be prudent to get a subsequent event disclosure in there on the impact of the pandemic. and also the related impact to the county's investments. So that is a new disclosure that you'll note this year as it relates to subsequent events on page 872. The next report I wanted to discuss is our required communication with the county board. So this is commonly referred to as a SAS 114 letter or a management letter. And this is the shortest of the documents you've been provided. This communication is required by auditing standards and really just intended to provide you all with an overview of the audits and just make sure that you understand your responsibility in overseeing the financial reporting process of the county. So starting down at the bottom of page 1, we do make reference to the county's significant financial reporting policies, which again are identified in note 1 of the financial statements. And there again, you'll see the reference to that GASB 84 restatements footnote that I walked through a few moments ago. So we had no issues or concerns with alternative accounting treatments in the current year. As part of the financial reporting process, management's required to come up with estimates for certain items reported in the financial statements. Some of those significant estimates are around the fair value of investments, pension and OPEB liabilities. The depreciable lives of capital assets are also a significant estimate within your financial statements. As far as financial statement disclosures go, the significant disclosures that we would want to call your attention to relate to investments, the net pension liability, other post-employment benefits, and tax abatements. And as part of the audit process, we did identify a few journal entries. Those were recorded and posted. We also identified journal entries that were deemed to be immaterial to the financial statements and ultimately, as a result, were not recorded. We have no concerns around the county's application of accounting principles, no disagreements with management. So as I mentioned, the audit, I would say, went very smooth this year. Typically, the schedule works out. We're out for planning and interim procedures toward the end of maybe mid-November, and then we're out for our year-end field work toward the end of January, and we're there for about 4 to 5 weeks. And throughout that entire process, the accounting department, the accounting team was very helpful, very responsive, ready to go when we were on site. We had no major issues come up as part of our audit work this year. And again, given the turnover, we certainly appreciated the ability to still work through a nice, smooth, efficient audit this year. So the second part of our letter relates to the internal control procedures, which I won't spend a lot of time on the detail on these. We'll just point out that in the prior year, we had reported 3 comments related to a risk assessment, some items related to grants, and then some issues as it relates to EMS. Happy to report this year that 2 of those 3 comments have been addressed and were able to be removed from the letter. The last commentary just deals with an EMS report issue as there was a switchover in that process in 2019. Starting on page 5 of our letter, that discusses other matters, which primarily consists of upcoming GASB pronouncements that the county is going to be required to implement in future years. GASB continues to be very busy. We're up to actually GASB 95 now, but GASB 95 is actually a welcomed standard for most governmental entities, as this actually was a response to the pandemic and provided some relief in terms of implementation dates on these upcoming GASBs. Most notably is going to be that the GASB 87, which deals with leases, has been now postponed to 18 months, which is going to allow the county to continue to prepare for the standard, as it is likely to have a significant impact on most government, the county being included there. So GASB 87 would probably be the biggest one to consider there. And again, some additional time now to be able to plan for that implementation. And we've had discussions with management on all the upcoming standards and really have no concerns with any of them and the county's ability to comply with them. That covers it for the SAS 114 letter. So the last item I wanted to cover today is our single audit report. So since the county expended more than $750,000 in federal awards, you're required to have a single audit performed. So this audit is performed in accordance with government auditing standards and also the federal uniform guidance. The uniform guidance requires that we identify and test what are referred to as major programs, which is driven primarily by dollar amounts and risk within those programs. Those change year to year. Obviously, with all of the significant funding coming in the current year, there's bound to be changes to the testing next year in terms of what's major and what's not. Certainly, we're still paying attention to the requirements and information that's coming out from the federal government as it relates to the audit of these funds. How they fit into the scope of the single audit is still yet to be determined, but it's pretty much the consensus that these funds will be required to be audited in some form, whether they are falling under the purview of the uniform guidance or some other type of compliance testing that will be performed on the significant funding that the county has received in 2020. But regardless, in 2019, we did have 3 major programs, which were aging, WIC, and a highway planning and construction cluster. And again, happy to report we had an unmodified clean opinion on compliance with these major programs and no single audit findings reported in the current year. So a clean single audit report for 2019. With that, I'd be happy to address any questions that you all may have at this point.
Well, looking around, I don't see any questions. Thank you for the opinions and the summary. And it looks like it's, I'm glad that those 3 items from last year, 2 of them are cleaned up. And so congratulations and thank you.
All right. Thank you, John.
Moving on to Hope.
Okay. Thank you, John. I know that 2019 is a bit in the past and a lot has changed since then, but the 2019 financials show that we're in a strong financial position. Sedgwick County is required by state law as well as by various bond covenants to produce financial statements annually within 180 days of the end of the fiscal year. That financial report is published in the form of the Comprehensive Annual Financial Report, which we also refer to as the CAFR. Not only are we required to publish our financial statements, but we're also required to have those financial statements audited by an independent CPA firm. The audit was conducted by BKD. As John mentioned earlier, the financial audit is complete and BKD has issued the county an unmodified opinion, stated otherwise as a clean opinion, which is the highest grade that we can achieve. The Division of Finance has published the 2019 CAFR and that document has been delivered to you. The CAFR provides a very complete and accurate disclosure of the result of the county's financial activity for 2019 fiscal year, which ended on December the 31st. The financial report, and more importantly, the day-to-day financial activity, accounting activity, that was required in order to generate the numbers that go into this report was produced by my accounting staff. I would like to take this opportunity to recognize the individuals from the accounting team who were primarily responsible for putting together this 170-page document. Those members were Brandy Bailey, Rebecca Wadsworth, Amy Walters, Mandy Estes, and Lynn Newby. The county accounts for its financial activity in 2 different ways. We are required to primarily answer questions about our near-term financing capabilities. What does that mean? Well, in the private sector, the primary interest of the entity is to know whether or not they made a profit and what their overall financial position is. That is a long-term view of the finances of an entity. In the public sector, we are not here to make a profit. We are here to deliver services that can't be delivered by private entities to our community, and in order to provide those services, we have to have the ability to fund those services. There are 3 perspectives for analysis. The first one is near-term financing. This produces the traditional fund statements, and what that means is that instead of consolidating all of our accounts and records into one, we maintain separate sets of books for dedicated funding streams that we have for specific activities that we need to keep segregated. Those fund statements produce information that I'm going to share with you today. The second is financial position. This is the traditional way that businesses report their financial information. For the traditional statements, we produce what are called entity-wide statements that establish our financial position. Just like a private corporation, this rolls up all of the activities of various divisions into a single set of financial statements. And third is the long-term trends, and these are shown in the statistical section of the CAFR. There are two bases of accounting measures that are used in the CAFR, and the first one is the modified accrual. And the traditional statements use this modified accrual approach. And basically, it's a combination of the cash basis method and the full accrual accounting method, and that basically is in terms of the revenue recognition. That's where it's a little different. And the second is the full accrual, which the entity-wide statements use. Next, we will get into the traditional fund statements, but before we do, I just want to let you know that the page numbers are going to be at the top of each slide, and so if you need to look back later and see where that data came from, that's where you can find that information. I will begin with the traditional fund statements, and I'll begin with the fund balance. Fund balance is the amount of net assets that we have on hand within our accumulated governmental funds at the end of the year. This chart shows 5 years of history so that you can get a sense of where changes have occurred over the last 5 years and what kind of changes transpired. This chart is divided into different colors, each representing a different fund or fund type for all of the county's governmental activities. The green at the bottom is the county's general fund, which is the largest single area of our financial system, and it's where most governmental activities take place. The general fund ended in 2019 with a fund balance of $71.7 million. The chart shows that over the last 5 years, the general fund balance has ranged from $63 million to $71.7 million. The blue segment immediately above the green represents our federal and state assistance funds, which are also known as grant funds. The 5-year trend represented here shows that it's been relatively consistent over the last 5 years. The gray segment represents all other funds, which is a combination of the fund balances of the fire district, the special revenue funds, and the capital project funds. And you can see that fund balance for all of those other funds was $53.6 million. There's a thin blue line that represents debt service, and it was $2.2 million. The orange segment immediately above that represents our debt proceeds fund. These are the funds that account for bond proceeds from the sale of debt that hasn't been used either to pay for the projects or to refund the debt for which the bonds were sold yet. The fund balance for that set of accounts is $12.5 million. Finally, at the top of the chart, you see the Public Building Commission Fund, which had an ending balance of $1.2 million, and that is primarily money that was collected by the Public Building Commission to pay for a building on Wichita State University's Innovation Campus, and the bonds that the PBC sold to pay for that building will be repaid solely with the proceeds of the Wichita State University mill levy that we impose. Now we will look at the general fund. This chart identifies 5 years of general fund balances, and it identifies the classification of fund balances within each year. The red color at the bottom represents the non-spendable fund balance, which are net assets that are related to inventories, receivables, and other things that can't be readily spent. The gray bar represents the assigned fund balance. Every year when we adopt a budget, we budget for a large amount of contingencies in case of a major storm event or a major crisis, and that's to provide legal spending authority. We don't expect the storm to hit or the crisis to occur every year, so we don't want to raise property taxes every year to fund those contingencies, and so we fund them with the fund balance. When we do that, we are assigning that fund balance. We are designating a use for it in the subsequent year, and you see that designated fund balance, or what we refer to in accounting as the assigned fund balance, which was $13.2 million. The light green segment at the top of the chart is called unassigned fund balance. That's the amount of the general fund balance for which there has been no designated use. The sum of the unassigned fund balance and the assigned fund balance of $45.9 million and $13.2 million at the end of 2019 equals what we term in accounting as unrestricted fund balance. The county has a fund balance policy that states that the unrestricted general fund balance should never be less than 20% of budgeted expenditures and transfers into the general fund. What you see on this slide is a demonstration of our compliance with that policy limitation. We ended the year with $59 million of unrestricted fund balance. Budgeted expenditures are $212.9 million, and the 20% threshold for that is $42.6 million. Our unrestricted fund balance at the end of the year stood at 27.7% as compared to our 20% minimum threshold and exceeded that minimum threshold by $16.4 million. Now I'm going to spend a little bit of time looking at the near-term financing indicators of financial condition within the traditional fund statements. One of the key questions that we want to be able to answer has to do with budgetary solvency of our governmental funds. And the first question is, are the county's annual revenues sufficient to pay for the annual budget? What you see on this chart shows 10 years of history, and for each year, it identifies the percentage that revenues made of expenditures. What you want to see, ideally, is for those data points to be right at or slightly above the 100% line. What we see on this chart is that we have consistently been below the 100% line. In 2019, our governmental fund revenues amounted to be about 99% of governmental fund expenditures. To get a more reasonable picture of whether or not we were able to pay for our own operations, we use the operating solvency indicator, which takes the same revenue base and compares it to the governmental fund expenditures, but it excludes the PBC, debt service, and debt proceeds funds. This is a measure of our operating solvency as opposed to the last slide, which was our budgetary solvency measure. Again, we would like to be at or above the 100% line. In 2019, we ended the year with revenues at about 102.2% of expenditures. Another question that we want to be able to answer has to do with the flexibility of county finances. To what extent do we have full control over the use of our resources? And in order to answer that question, we look at the total debt service, which is the total principal and interest obligation that the county has incurred as a percentage of all expenditures that we have also incurred. To the extent that we have debt service expenditures, obviously they will take priority over everything else because we have contractual obligations that we have to fulfill. At the end of the year, our debt service expenditures amounted to 5.5% of all governmental fund expenditures. You see on this chart that we have consistently been between the 4 and 6% range, except for the years of 2012 through 2014, when our debt service expenditures spiked because we were engaging in a series of refundings, paying off bonds prematurely during those years. The next question we want to ask is whether or not the county has had any difficulty paying its short-term obligations, and this is a measure of liquidity. This measure looks at the total cash and investments that the county had on hand at the end of the year as a percentage of the liabilities that the county also had on hand at the end of the year. What this chart shows is at the end of 2019, our cash on hand amounted to $8.70 for every dollar of liability, and that's a great liquidity situation to be in. You see that our liquidity was much better at the beginning of the 10-year period, and that's because that's when we were in the process of building Interest Bank Arena. The county had imposed a special sales tax in 2005 and continued collecting that revenue through 2007. And during that period of time, a little more than $200 million of revenue was collected. We put that money in the bank, and then starting in late in 2007, we began spending it to build Interest Bank Arena. From 2006 through 2010, our liquidity was elevated because we were sitting on that dedicated sales tax cash that hadn't yet been used. This is the final measure of near-term financing. How much are we relying on other governments to fund our activity? What is total intergovernmental revenue as a percentage of total revenue? What we have seen over the past 10 years is that intergovernmental revenue has consistently been between 14 and 16% of all revenue within our governmental funds. This chart shows that we are not heavily reliant on intergovernmental revenue to pay for our operations now or even in the past 10 years. The percentage for 2019 was 14.1%. Now we will dive into the entity-wide financial statements. The entity-wide statements are the statements that wrap all of the county's financial activity into a single set of financial statements on a full accrual basis, similar to what private businesses do. I begin with the county's net position or the county's net worth. The county had a net position at the end of 2019 of $494.4 million, identified by the series of bars on the left-hand side of the chart. Each bar represents a separate year. 2019's ending net position of $494 million was a little less than the level of 2015 when our net position was $507 million. The drop in net position is due to a new accounting rule from the Government Accounting Standard Board, also referred to as GASB, that took place for the first time in 2015, reflecting our CAFR's plan. you can see the chart shows that once we implemented the new standard, our net position has then stayed relatively consistent. Within each bar, you see the composition of our net position. The green segment identifies capital assets, net of any debt outstanding that was used to pay for those assets. The 2019 total is $465.9 million. The blue segment represents restricted net position, and the nature of the restrictions is illustrated in the pie chart on the right. There are 8 identified restricted funds listed. The county's total restricted net position at the end of 2019 was $43.7 million, $3.4 million less than the previous year. The significant reduction in the restricted funds from 2017 through 2018 is due to the refunding of the 2008 PBC bonds for approximately $26 million. Finally, the light blue segment represents unrestricted net position, and that's where the change has taken place, as I described earlier, for our CAFR's fund from the GASB standard. So what we want to know with financial position, perhaps the most important question in this presentation, is did it improve or did it deteriorate? What this chart shows is that our financial position improved by just over 0.5%, which is a very good indicator of our financial position going into 2020. In the statements of activities, our beginning net position was $491.4 million, and our ending position was $494.4 million. During the course of the year, the financial activity of Sedgwick County was relatively flat. However, our financial position improved because our revenues exceeded our expenditures by over $3 million. One of the things that we're always concerned with is the extent to which the various activities of the county are able to support themselves with their own self-generated revenue. We are not in the profit-making business, so we don't expect governmental activities to be fully self-supporting. But to the extent that they can generate their own revenues, it means that we do not have to provide tax dollar supports in order to pay for those activities. So what this chart shows are the various activities of the government. The functions of government are represented by a bar, and within that bar, the total is the amount of expenses that were incurred for the year. The green area is the amount of program revenue or self-generated revenue that the activity produced to pay its bills, and the blue area is the amount of general revenue or tax-supported revenue that was necessary to pay the bills for that activity. What the chart shows is the largest single area activity of Sedgwick County in terms of expense is public safety. During 2019, we spent $163 million on public safety activities. Public safety was able to produce about $40.5 million of program revenue through municipal jail fees and various grants to cover those bills, but the balance of $122.5 million was required to be provided by taxes levied on Sedgwick County citizens. So 75% of public safety activities were funded by taxes. General government and health and welfare activities both incurred about $56 million in expenses. However, general government required about 61% tax support, while health and welfare activities, ComCare, the health department, CDDO, and aging services only required about 20% of tax support. Of that $56 million in health and welfare activities, $45 million was paid for with program income generated by those activities, fees that are imposed on clients of the Human Services Department, and grant revenues that are collected to provide services to clients of the Human Services Department. There are different measures that can be looked at to determine the adequacy of financial position and of the entity-wide statements. What I'm going to focus on here is the solvency measure, which looks at the county's ability to pay off its long-term debt with its assets. What we're doing here is taking long-term liabilities as a percentage of assets, and what we see is that in 2019, we ended the year with long-term liabilities equal to about 31% of assets. In other words, 31 cents of every liability was covered by $1 of assets. The county is in very good condition to pay off its long-term debt. Just a note, the 24 increase from what traditionally had been about 20% was due to that debt refinancing that we were undertaking that I discussed earlier. The 2015 spike up to about 35% is due to the CAFR's liability that we discussed earlier that we needed to reflect on our books. The last tab in the CAFR is the statistics section. This section contains a lot of good information for anybody who might be interested in evaluating Sedgwick County finances. I'm going to spend a little bit of time showing some of the indicators and some of the trends that can be identified by looking at these statistics. First, we'll look at the 10-year history of governmental revenue and expenditures. On this chart, the green represents revenue, the blue represents expense. What you would hope to see is the green line above the blue line. In 2019, that is the case, as revenues are $348.8 million and expenses were $340.8 million. You can also see the extent to which revenues and expenses have grown over the 10-year period. The chart shows that neither have grown very much, and in fact, during much of that time period, expenses were decreasing yearly. We can also determine where the county has been placing its emphasis over the past 10 years by looking at the change of expenses over that 10-year period by function. And what this chart shows is the amount of increase or decrease of expenses in 2019 versus 2010. The greatest source of increases for county expenses over that 10-year period has been public safety at $20.44 million. Public work expenditures increased $1.22 million. Culture and recreation expenses increased $3.87 million over that 10-year period. General governmental activities increased $4.4 million. Health and welfare experienced a substantial decrease of $10 million in expenses. That's a function of budget reductions that were made primarily in 2012 when the health and welfare activity incurred a 6.7% budget cut, and during that period of time, there were also reductions in staffing at ComCare and Aging. Additionally, in CDDO, there have been a reduction in the amount of state support for some of the CDDO activities. Within our revenues, I've talked before about the expectation that activities generate program revenue as much as possible to pay their own way so that we don't have to levy general taxes on our citizens. And what this chart shows is 10 years of history of property tax revenue represented by the blue line and then program revenue represented by the green line. Property tax was nearly $24 million higher at $178.74 million versus $154.37 in 2010. Over the 10-year period, program revenue decreased 2010 through 2013. There were decreases in program revenue pretty consistently. And during that period of time, property taxes took a slight dip but stayed essentially consistent over the 10-year period. As a result, at the end of the 10-year period in 2019, property taxes now are substantially higher than program revenue, $178.7 million versus $122.3 million. What the chart shows is that over this past 10 years, the county has become increasingly reliant on property taxes as the principal funding stream to pay for county services. I just wanted to point out the significant drop in program revenue from 2015 to 2016 is attributed to 3 programs: the Affordable Airfares, the Elephant Barn, and Public Works. Because we're so reliant on property taxes, we pay a lot of attention to the collection rate. How effective are we at collecting property taxes that have been levied? This chart shows 10 years of history for those collection rates. This chart shows the tax year that is funding the budget year. So for example, 2018 taxes funded the 2019 budget. The most important thing to emphasize here is the county's collection rate, which is controlled principally by the activities of the county treasurer. At its very worst over this 10-year period in 2010, the county collected 96% of all taxes that had been levied. In other words, unpaid taxes represented less than 4% of the total levy. That was the worst that has been performed over this 10-year. You see that the collection rate from that low point in 2009 has steadily increased. The tax year ended with a collection rate of 97.88% in 2019, the highest collection rate that we have on record. This indicates that the treasurer has been doing a very effective job of collecting property tax, which is important for us because, again, it's one of our primary sources of funding for county government. We will now talk about long-term debt. What you see on this chart is 10 years of history for the county's outstanding debt, each year represented by a bar, and within each bar, there are different colors representing different categories of debt. In 2019, the county had $50.9 million of general obligation debt. That's the green at the bottom. We had $2 million of special assessment debt. That's the thin blue line immediately above the green. We had $88.8 million of PBC debt. We had a very slight amount of about $1.9 million of lease debt that's represented by the fire apparatus, and that's the black at the very top of the chart. What this chart shows is that the general obligation debt of the county has decreased steadily since its peak in 2012 at $86.8 million, down to now $50 million. The PBC debt started decreasing in 2012 and 2013, but then spiked in 2014, and that was again caused by the refunding that we did in that year. So we sold additional debt for the refunding, and it was also caused by the PBC's funding of a building for Wichita State University on the new Innovation Campus. That debt will only be repaid with the proceeds of the special property tax that is levied on WSU, and so it's not a general county obligation. Here in the statistics section, there are charts that show 10 years of data about county performance. This is what citizens are most interested in, is what do they get for their money. So the question is, what did the county do with all of its money in 2019? Let's begin with public safety activities. In 2019, we averaged nearly 45,000 calls per month in our emergency communications center, the 911 center. That was a 6% increase from a year ago and a 22% increase from 10 years ago. EMS responded to almost 5,500 calls per month in 2019, and that's a 4% increase from last year and a 26% increase from 10 years ago. In the juvenile detention facility, the average daily population was 55. That was 4% more than last year and 51% less than 10 years ago. That's due to the policies that you and your predecessors have adopted over the past years to intentionally try and reduce the need to house juveniles in detention facilities, and it is showing us successful. The adult detention facility had 1,529 people in custody on average every day of last year. That was 2% less than a year previous and 8% more than 10 years ago. We provided those public safety services with 1,463 employees at the end of 2019. That was 3% more than a year ago and 5% less than 10 years ago. In terms of fire service, the fire department reported that in 2019, they responded to 185 residential fires per 100,000 households. That is reported as a 12% decrease over a year previously, but a 15% increase over 10 years. In 2019, the fire service responded to an average of 364 medical calls per month. That's a 6% decrease from a year ago, but a 25% increase from 10 years ago. And the fire district provided those services to the county from 9 fire stations. In health and welfare services, ComCare saw 15,603 health clients in 2019, an increase of 19% over 1 year and a 25% increase from 10 years ago. CDDO, the Community Development Disabilities Organization, had 2,589 citizens of Sedgwick County who were eligible to receive its services. That was a 2% increase over 1 year and a 14% increase from over 10 years ago. We provided health and welfare services with 510 employees, an increase of 2% from last year, but 16% fewer than 10 years ago. In public health service, we had patient encounters, or also called appointments, with 126,511 clients. That was a 3% decrease over 1 year and a 28% decrease from 10 years ago. We provided 19,059 immunizations, a 9% decrease from the previous year and a 19% decrease from over 10 years ago. In culture and recreation, the Sedgwick County Zoo had attendance of 518,446 visitors in 2019, a 3% increase from last year, but a 6% increase from 10 years ago. 6% decrease from 10 years ago. Sedgwick County Park had an annual attendance of 997,945 people, a 1% increase from a year ago and a 3% increase from 10 years ago. Culture and recreation services were provided with 101 employees, 6% less than a year ago and 10% less than 10 years ago. At Interest Bank Arena, we had 93 events in 2019. The building wasn't open 10 years ago, so we only have data from last year. But over 1 year, that was an 11% increase. The annual attendance was 348,357 people, which is a 1% decrease from 2018. The most important statistic on this slide for the arena is that it returned at the end of 2019 a total of almost $2.9 million to the Sedgwick County from operating gains by SMG, the operator of the facility. That's a 12% increase over the amount of money that was returned previously the year before to Sedgwick County. In Public Works, the number of road miles improved was 105, a 1% decrease over 1 year ago and a 38% increase from over 10 years ago. The number of miles that Public Works is responsible for in Sedgwick County was 609, which is no change from last year, but a 1% decrease from 10 years ago. And that decrease is attributable to roads being annexed by cities over this 10-year period. The Household Hazardous Waste Facility handled 631 tons of waste, a 5% increase from last year and a 6% increase from over 10 years ago. Public Works services were delivered with 128 employees, which is an increase of 1% over 1 year and a 3% increase over 10 years. Finally, in general government services, in 2019, we served 301,756 voters. That's a 1% decrease from the year before, but a 16% increase from over 10 years. We dealt with 216,109 taxable real estate parcels, a 1% increase from last year, and a 1% decrease from 10 years ago. The Register of Deeds processed more than 73,000 documents, a 2% increase over a year ago, and a 3% decrease from 10 years ago. The Register of Deeds and the county clerk together processed 74,432 real estate records, a 2% increase over 1 year, and a 19% increase over 10 years. General government activities were produced with 408 county employees, which is a 1% increase over 1 year and a 14% decrease over 10 years. What we have here in these slides and what I have just addressed is a relatively common theme. Over the past 10 years, the demand for and the delivery of services by Sedgwick County government has increased. The amount of people providing these services has decreased. Over the past 10 years, Sedgwick County has become a more efficient organization, which is great news for our citizens and a major takeaway from this presentation. At this time, I would be happy to try and answer any questions that you guys might have.
Okay, Hope, that was a lot. Thank you very much.
You're welcome.
The stuff at the end is really good too. Anybody got any questions on the report? So, okay. Thanks, Hope. Appreciate it. We have to receive and file this one, I assume. Motion to receive and file the CAFR report. Second. It's been a motion and a second. Any other comments? Being none, Madam Clerk, call the roll, please.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Aye. Chairman Meitzner?
Aye. Madam Clerk, next item, please.
Item H, presentation of the quarterly financial report.
Okay, Brent, welcome back.
Thank you.
Did you change ties? I'm kidding. Okay.
I didn't even spill anything. Good morning, Chairman Meitzner, Commissioners. Again, for the record, I'm Brent Shelton, the Deputy CFO. We're going to present now the quarterly financial report, which will be an overview of the financial or the fiscal status of the county during the first quarter of 2020. We're going to do some comparisons with the prior first quarter from 2019. I would remind you that the quarterly financial report is based on unaudited financial statements. So these are subject to some adjustments that might be made when the annual audit is completed. I would be remiss if I didn't thank the members of the budget and accounting teams that have helped put this presentation together. Lori and Showalter Airy and her team, Carly Sanchez, Lee McCrae, Tabina Zott and Elizabeth Thornburg. And in accounting, Hope Hernandez and her team, Mandy Estes, Brandy Bailey, Rebecca Wadsworth, and Lynn Newby. I'll speak on behalf of Lindsay for just a moment and tell you that she and I are both very pleased to have this capable team helping us as we guide the county's finances. This report will stay at a fairly high level. Feel free to ask questions. And the document has been delivered to you, and once received and filed, we'll be putting it on the county's website for public consumption. The final thing about this quarterly report that's a little different than what we've seen in the past is that, like all of them, it's based on historical information. However, in the first quarter of 2020, we did experience a rather exogenous event. So a lot of the things that we're seeing in the 2020 first quarter are going to be affected a great deal by COVID and by the pandemic response. So we're beginning to see some changes that aren't necessarily reflected in these numbers. Let's take a quick look at the one place where we do get to do some projections in the quarterly report, and that is talking about the projected year-end fund balance for our 6 different operating areas. If I could direct your attention to the middle of this slide where you see some red numbers, and those would represent decreases in fund balance from the prior year. So the one I would, I guess, the few to point out, one is that in the county general fund, we're anticipating that our fund balance would reduce at the end of 2020 versus the end of 2019 by about $5.5 million. As you have heard in some of the budget presentations, we are anticipating and going and forecasting lower revenues in the general fund and throughout the county as a result of the COVID response. But we've also done some things to minimize or reduce what were termed unessential expenditures at this time. So right now we're looking at about a $5.5 million fund balance decrease. In our debt service fund, you just saw from Hope that debt service payments have been reduced. And if you'll recall, when you adopted the 2020 budget, the mill levy for debt service was reduced by about 1 mil or $5 million. So that is going to contribute to that lower fund balance. We're seeing some increase in some of our grant monies in some of the non-property tax supported funds, specifically in ComCare and in aging. We'll see some more detail on that in a little bit. And then the capital improvements that are being made at the arena are going to reduce the fund balance in that enterprise fund. Let's take a little deeper look now at the county property tax supported funds. And what this will indicate on this slide is that we saw about a $7.5 million increase in revenues year over year for the first quarter of 2020 versus 2019. That's about a 7% year over year increase. So we are seeing healthy revenue increases on those property tax supported funds. At the same time, our expenditures were remaining relatively flat, just about an $800,000 increase in the first quarter versus the first quarter last year. Some details on what was happening here is that we went into the 2020 budget with a higher property tax base. It was about a 4.5% increase in assessed value, and that was reflected in higher ad valorem tax collections. We saw some growth in our sales and use taxes in the first quarter of 2020 versus 2019. Motor vehicle taxes were about almost 11% higher in the first quarter of this year versus last year. So there's been some healthy economic activity going on in the first quarter. Insurance fees are the next line item that you would notice there, and I point that out because it's got a rather substantial, almost 375% increase. Those are the fees that we are receiving for EMS billings, and that represents an increase over the first quarter last year It's more putting us back to where we were in 2018 as a result of some slower collection activity when we went to when we began to outsource that project back in 2019. And I guess if I would draw your attention to the bottom line where it talks about officer fees, these are the document filing fees that are received by the Register of Deeds office. You'll note a 30.7% increase in the first quarter. We're experiencing a low interest rate environment. We're seeing a lot more, or we were seeing a lot more real estate and mortgage filings in her office, in the Register of Deeds office, so that attributed to that increase in revenues. If we begin to look at expenditures, let's start with our personnel expenditures, which, as you know, are the highest expenditure item that we have. And our salaries and wages and total personnel costs year over year for the first quarter were almost flat. Now, while we did enjoy a 2.25% pay adjustment for all county employees, we had a little smaller footprint in terms of the number of employees first quarter of this year versus last, so that entire 2.25% didn't get realized. And the rest of this pretty much will indicate a realignment of how some of those personnel costs were allocated. Less overtime, less callback and on-call activity in the sheriff's office. We also had a one-time bonus pool that was about $500,000 first quarter of 2019 that didn't get repeated in the first quarter of 2020. So basically, year over year, that first quarter stayed flat in the personnel area. In non-personnel expenditures for those property tax supported funds, I would just point to a couple of items on this chart. We had software and hardware maintenance that increased by 40%. This is the beginning of the HR Focal Point project, which was about $300,000, and we had some additional expenditures for SAP support in the first quarter of 2020 versus no expenditures for that in 2019. The sizable increase that you see in medical professional services is a result of higher populations in our detention facilities, both in the jail and in corrections, resulting in higher medical professional charges there. We take a look at the fire district for just a moment. We see, as with the rest of the county, strong revenue growth in the first quarter, 5% or about $500,000 increase. Expenditures in the fire district were relatively on the same trajectory as we've seen since 2016 on this chart. They're significantly lower than the first quarter of 2019, but we did have a large transfer of $1,750,000 that affected 2019's first quarter versus 2020. This will depict some of those changes in a little more detail. We see the increase in ad valorem tax collections. The fire district also experienced pretty significant growth on a percentage basis in motor vehicle tax revenues. And then on the bottom line, you see that transfer that occurred in the first quarter of 2019 didn't occur in the first quarter of 2020. Shifting gears for a moment to the non-property tax supported funds. We maintain about 35 of these types of funds. They're not as directly supported by property tax, but more by service revenues, grants, and things of this nature. What we notice on this is about a $5 million increase in revenue year over year for the first quarter of 2020 versus 2019. And on the second slide, you'll see about a $2 million decrease in expenditures comparing the first quarter of 19 versus the first quarter of 20. So what attributes...
Brian, can I ask a quick question?
Sure.
Is that seasonal just for the quarter?
Pardon me?
Is that seasonal this jump in revenue and then the decrease in tax in expenditures? Or is that just a snapshot right now? Does that happen every year on the first quarter? Okay.
On the first quarter, that's comparing first quarter of 20 versus first quarter of 2019, and we had a bigger tax base.
Okay.
Our value went up by about 4.5%. I'm not sure what's going on with the motor vehicle taxes. It's just people buying cars. Okay, so for the top 10 revenues in the non-property tax supported funds, we mentioned earlier that there would be a higher fund balance in some of the non-property tax supported funds from some higher grant activity, and we're beginning to see that in the state revenue from the Kansas Department of Aging and Disability Services on the top line. We're also seeing that increase being offset when we started to see some reduction in services that were delivered in some of these areas as a result of the beginnings of the social distancing, some office closures and things like that. So we did see fewer Medicaid reimbursements, Medicaid waivers, and so forth. In terms of the expenditures, what we're basically seeing here is, again, with the Medicaid pass-through payments and those types of activities, we saw a slowdown in some of the service delivery. So we also deliver some of those services through third parties. The payments come to us and they're passed through. So some of that activity began to decline in the first quarter. And I think that's all on that slide that I would point out. The next slide shows you the cyclical nature of the general fund fund balances that we maintain. Now, in the first quarter of the year, we collect first half tax revenues. In the second quarter, we get the second half tax revenues. So we see a lot of receipts in the first 2 quarters of the year, and then those are spent down throughout the year. So to see this chart going up and down like this is a normal thing. It does have a bit of an upward trajectory, which would support the things that Hope mentioned about the strong financial position that we're in. The next slide just shows the same information, only as what our unrestricted balance is as a percentage of our budgeted expenditures. The county policy states that we will maintain an unrestricted fund balance of at least 20% of the budgeted expenditures, and you can see for the duration of this chart that we have maintained or exceeded that fund balance. I'm happy to report that our investment portfolio made $10,000 more in the first quarter of 2020 than the first quarter of 2019. I'm probably not going to be able to give you that type of a report in the second, third, and fourth quarters of this year because, as you know, interest rates have not only declined, they've sort of fallen off the cliff. As a point of reference, one-year treasuries yielding 2.25% to 2.4% over the last couple of years are at about 0.18% today. So we are anticipating going forward significantly less earnings on our investment portfolio. So if I would leave you with some key points, I would tell you that in looking at this information, the county's fiscal condition in the first quarter was sound. I think we are still in sound position. The COVID-19 impacts had not yet been measured. We just began to see those impacts in the first quarter of 2019, but haven't really had enough information to be able to gauge that. We were seeing, as you know, local unemployment increases due to the aerospace layoffs, but the underlying economic activity hadn't really affected us on a fiscal basis at that point. We've seen consistently strong revenue growth over the first quarter due to the higher tax base, retail and motor vehicle tax increased collections, and we saw that lower interest rates, while it's hurting us on the investment side, there's some real estate activity. We're picking up some money on the document filing fees because of that activity. So our fiscal picture looked good. I think it still looks pretty good in spite of what we're facing with the COVID pandemic. As you know, we have forecast immediate and longer-term revenue declines. We're seeing non-budgeted expenditures for COVID continuing to increase. And as we move forward, we're focused on a couple of things. One is recovering as much of those pandemic-related expenditures through the CARES Act and other resources as possible. We're also focused on positioning the county, working with community partners for economic recovery coming out of this pandemic by taking advantage of some other financial resources that might be available out there. So with that, I will close and answer any questions.
Any questions? Commissioner Howell.
Thank you, Mr. Chairman. Just back on page, or slide number 6, if you did state the answer to this question, I apologize for asking it, but can you please explain or talk about the $1.76 million increase in insurance, on the insurance fees line?
Yes, that was a result of the EMS billing changes that we've made. Okay. So in this is about back to where we were first quarter 2018. 2019 was extra low because of the changes that have been in place, delaying some billings throughout the year.
Okay. All right, very good. Thank you. That's my only question, I think.
Okay. Any other questions? Being none, thank you, Brent. Entertain a motion to receive and file. Been moved and seconded to receive and file. No other questions. Madam Clerk, please call the roll.
Commissioner O'Donnell? Aye. Commissioner Dennis? Aye. Commissioner Howell?
Aye.
Commissioner Cruz? Aye. Chairman Meitzner?
Aye. Madam Clerk, next item, please. Thanks again, Brent. And Lindsay.
Item I, a resolution
Oh,
establishing the date, time, and location of a public hearing to consider petitions requesting boundary modifications to the BOEING Industrial District of Sedgwick County, Kansas, and providing for notice of such public hearing.
Good morning again, Chairman Meitzner and members of the County Commission. I didn't have time to change my tie between the last item and this one.
Okay, thank you.
This item before you today is an action where you are being requested to establish a public hearing. To give you a little bit of background, the Board of Directors of the BOEING Industrial District met on April 24th, 2020, and they adopted a resolution requesting approval of some modifications to the boundaries of the district and for renaming the industrial district. Yesterday, the city councils of Wichita and Derby unanimously adopted resolutions recommending approval of modifications to the boundaries of the BOEING Industrial District. Now, the state statutes permit that the boundary modifications to an industrial district have to be approved by 100% of the affected property owners. They need to be requested to be added or removed, and that has happened. And in this case, there are 5 parcels that are affected, 4 that would come into the district that are part of the Air Capital flight line, and some properties that more line up with Spirit's activities in that area. 1 parcel would be removed because it's not directly related to their activities. That petition from the industrial district's been duly filed with the county, and pursuant to the industrial district statutes, when that petition is filed, and then provisions to the approvals of the cities recommending that approval, the Board of County Commissioners shall then fix a time and a place for the hearing of such petition, and then cause the county clerk to give notice of thereof by 1 publication in a newspaper published in a general circulation in the county at least 15 days prior to the date for that hearing. So this item is simply for you to approve a resolution to establish a public hearing for the regularly scheduled county commission meeting on Wednesday, June 10th, to consider those 2 items, the boundary modifications and the name change for the BOEING Industrial District. So I would recommend that you approve the resolution and establish the public hearing.
And did you say, Brent, that the City Council of Wichita and Derby, they've already approved this, or they approved to set a date for a hearing?
They have approved a resolution recommending the boundary modifications. So
Okay.
they're okay with these changes to the industrial district. And because they're within a 3-mile radius of the district, they both have to do that.
But we're the official approver then?
Yes. This is coming
It's the
before you
county,
because
okay.
all of the industrial districts in the county were established in 1979 and 80 by county commission action. So any boundary modification or change to the district has to be approved by you.
Okay, all right, thanks for clarifying.
Mhm.
Any other questions? Okay. Yes.
Yeah, this is District 5, so I'd like to make a motion that we would set the hearing date for June the 10th, 2020, and direct the county clerk to publish the notice of hearing once in the official county newspaper.
Second.
Been a motion and a second. Any other comments? Being none, Madam Clerk, call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Thanks again, Brent. Madam Clerk, next item, please.
Item J, reconsideration of item 3 of the items for procurement originally heard at the April 29th, 2020 meeting of the Board of County Commissioners, tract excavator, Public Works.
Good afternoon, Mr. Chairman and Commissioners. Joe Thomas, Purchasing Director. This item was originally presented to you on April 29th for the tracked excavator for Public Works Fleet Management. And there were some questions that were asked at that time. And since we've provided answers to those questions and would like to now make the following recommendation. We would like to recommend to accept the quote from Berry Tractor and Equipment Company based on the Sourcewell Contract 032119-KOM. And that's in the amount of $481,047. I'll be happy to try to answer any questions and recommend approval.
Commissioner Dennis?
Thank you. Thank you, Joe. I appreciate you getting all the answers that I asked. I did have one other question that I asked David Spears. Does he have a trailer to be able to haul this on? And he got back with me and said he did, because I didn't want him to come back later and say, whoops, we can't haul it to the job site. So I'm very satisfied with the outcome, and I move that we approve this item.
Second.
Okay, been a motion and a second to approve. Any other comments? Being none, Madam Clerk, call the roll, please.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Chairman Meitzner?
Aye. Aye. Thank you, Joe. Next item, please, Madam Clerk.
Item K, consideration of one item for procurement.
For the record, Joe Thomas again, Purchasing Director. This item is for Zix encryption, maintenance, and support, and that's for the Division of Information and Technology. The recommendation is to accept the quote from Zix Corp Systems Incorporated, and this is for a 3-year total cost of $130,380. I'll be happy to try to answer any questions you may have on this item, and I recommend approval.
Any questions?
Mr. Chair, I move that we approve the recommendations of the Purchasing Department and Bid Proposal Review Committees.
I move we approve it.
It's been a motion and a second to approve item K as presented. Being no comments, Madam Clerk, please call the roll.
Commissioner O'Donnell? Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Chairman Meitzner?
Aye.
Thank you, Commissioners.
Thanks, Joe. Have a good day. Madam Clerk, next item, please.
Consent agenda.
Good afternoon, Commissioners. Tom Stoles, County Manager. Recommend approval of consent items L through P.
Move to approve Lima through Papa.
Been a motion and a second to approve the consent agenda items. Any other comment? Being none, Madam Clerk, call the roll.
Commissioner O'Donnell? Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Chairman Meitzner?
Aye. Madam Clerk, next item, please.
Legislative issues.
Mr. Papoon.
Yes, Mr. Chairman, Mike Papoon, County Councilor. A number of things have been moving in Topeka of late. Speaker of the House and the Senate, President of the Senate, have called for 4 days of committee hearings this week, starting yesterday. We'll see what comes out of those hearings. There's been discussion about the tax issue that we have discussed on several occasions, delaying the penalties beyond the May 11th for late payment on the second half taxes, along with shielding some businesses from liability and related to COVID and some business loans and other issues. We'll see what these committees come up with. In addition, and I'm sure you've seen that the Attorney General is looking into the enforceability of the latest executive order on behalf of the Governor Kelly. And all of this is probably going to come to a head on May 21st, sine die, the next time the legislature, next and last time that the legislature will meet this year. See if they take any action on the 21st relating to any of these issues. That's all I have at this time.
Okay. Do we feel compelled that we need to weigh in on anything, or are we just going to watch and see? Probably best to watch and see and not do any poking at this point. I would agree, probably. Okay. Thank you for the report, Mike. Any other questions to Mike before we move on? Okay, being none, Madam Clerk, next item, please.
Other.
Any of the commissioners have anything under the other to share? I'm looking around, don't see anything. Okay. Next item, please, Madam Clerk.
Executive session.
Yes, Commissioner Cruz.
I move that the Board of County Commissioners recess into executive session for 15 minutes until, what do we say, 12:40? Yeah, 12:40. For consultation with an attorney for the county regarding matters deemed privilege in the attorney-client relationship in order to discuss pending litigation, and that the Board of County Commissioners will stay in this room and return to a live broadcast from executive session at 12:40.
I'll second that. There's been a motion and a second for move to executive session, which will be in this room. Being no comment, Madam Clerk, please call the roll.
Commissioner O'Donnell? Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Okay, we stand in executive session. We'll return shortly. Okay, welcome back. We have returned from executive session. No formal action was taken. And with that, I'll reference over to County Councilor Mike Papoon.
Thank you, Mr. Chairman. I want to make sure everybody has their mics on because they'll be recording a vote here. Yes, Commissioner, I would like to move that we approve the settlement in the lawsuit brought by Matilda Pruitt versus Sedgwick County in the amount of $310,000.
I'll make that motion. And I'll second. Okay, there's been a motion and a second to approve the settlement as stated by Mr. Papoon. So no other comments. Madam Clerk, call the roll, please.
Commissioner O'Donnell?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Aye. Chairman Meitzner?
Aye. Okay, no other business before the commission, so we will stand adjourned and see you again shortly.